All right. Welcome to the May 1st, 2023 meeting of the Human Services Committee. Can we please start by taking a roll call?
Councilmember Burns? Councilmember Revelle?
Here.
Councilmember Reed?
Here.
Councilmember Harris?
Present.
Councilmember Harry Harris?
Here. We have a quorum and are ready to begin our work. We will start things off with the approval of the minutes from February 7th.
I move for the approval of the February 7th minutes of the Human Services Committee.
Second.
All right. Is there any discussion or any corrections? I've already corrected it once, so I think we're good. Can we please take a roll call vote?
Councilmember Burns? Councilmember Revelle?
Aye.
Councilmember Reed?
Aye.
Councilmember Harris?
Aye.
Councilmember Harry Harris?
Aye. And with the ayes having that, that passes. Can I have someone move approval of the March 6th minutes?
I move for the approval of March 6, 2023 Human Services Committee meeting minutes.
Second.
Great. Is there any discussion? Seeing that we have no corrections or no discussion, can we please take a roll call vote on the approval of the minutes?
Councilmember Burns? Councilmember Revelle?
Aye.
Councilmember Reed?
Aye.
Councilmember Harris?
Aye.
Councilmember Harry Harris?
Aye. And that also passes. Now we will have our public comment. We have a number of folks signed up for public comment. We will start things off with people that signed up in person and are here in person. Given the number of people, we have 2 minutes each, and I will have the timer on for everyone here. So we will start things off with Dan Coyne, followed by Rob Beatty.
Thank you. My name is Dan Coyne, 9th Ward resident. Honorable Chair, City Council members, and staff, thank you for your care and service to our community. It makes a difference. You make a difference. I'm here to support something on your conversational table today, and that simply is the accessory gaming. I'm 100% supportive of piloting an accessory gaming in Evanston restaurants. Thank you for engaging this conversation on what I think is a potential resource, not only for our small businesses, but also for our city budget. I understand the hesitancy given the historical addictions and corruption in this particular field. But as in all new legal endeavors, one can envision oversight guardrails and proactive supports. After all, we seem to have managed our dry town hurdles without the entire city going in flames. And if you've noticed, our bakeries are flourishing despite the medical needs that our community has in slowing down on some of the unhealthy foods in town. And let's not forget the creative reparations lift in our recent THC and ordinances. Perhaps gaming can have similar successes beyond the projected financial gains for restaurants and our city budget. I do look forward to learning how we might incorporate a fun entertainment gaming pilot to help our business neighbors and patrons. My question is simply this: why send Evanstonian dollars into other communities when we could invest right here, for instance, at the Firehouse Grill and at the Bluestone? Thank you so much.
Thank you. We'll have Robert Beatty, followed by Bill Casper.
Good evening, committee. My name is Robert Beatty, 25-year resident of Evanston on the south end in the 8th Ward. Full disclosure, I am a sales rep, account manager for Eureka Entertainment, doing business as Universal Gaming Group. So we manage about 200 locations throughout Illinois, with 50% of the municipalities opting out and 50% opting in, of course, there's a lot of room for growth there. I'm here on behalf of not only myself, but I have an agreement with, full disclosure, with Pat Fowler of Firehouse and Bluestone. And we've been talking in some months past and decided that it was time to bring the conversation through committee and bring it to the council and bring it to the city. Pat Fowler is the owner of both of those establishments, but he also owns the Candlelight. And Pat employs about 130 people in Evanston. He was the only business owner to actually add to his business. He was the only business owner to add to his business during COVID. So he's pivoted many times. He started out as part owner of Candlelight and then moved to Firehouse and then to Bluestone. He is an Evanstonian that's helped out many nonprofits, and I really want to deal quickly with the stigma of gambling. Examples, you can gamble on your phone. You can, of course, gamble at CVS through the lottery, which we've all done when it's hit $1 billion. Local liquor licenses in Evanston. I am proposing a 2-year pilot for accessory gaming in a place like Firehouse that already has amusements. And I'm going to stop there. Thank you.
Thank you. Bill Casper, followed by Nadim Abi Anton.
Hi, my name is Bill Casper. I'm the Executive Director of Westminster Place, and I want to thank the committee for the opportunity to testify about the Fair Work Ordinance. Director Ogbo also, I speak directly as a healthcare provider. We appreciate the well-meaning of the ordinance. However, we have strong concerns about the proposed legislation and request that it not be approved or moved forward. We understand since the original presentation of the ordinance, the sponsors have agreed to eliminate hospitals and all other licensed healthcare facilities from its jurisdiction. If the legislation does proceed, we strongly assert that in addition to healthcare employers, nursing homes and the providers included in that group should also be excluded from the Evanston ordinance. Many of the same reasons apply to our organizations, and that is why in most jurisdictions across the nation where such ordinances have been enacted, both groups of health service providers have been excluded. Westminster Place is a long-term care provider in a highly regulated industry. We post our staffing schedules 4 weeks in advance. Managers recognize that this is an important driver of employee morale and engagement and work to ensure that any known scheduling changes for which employees need accommodation can be implemented on a timely basis and proper staff coverage can be arranged. To protect the health and safety of residents and staff, Westminster Place employees are instructed not to report to work if feeling unwell, making same-day call-offs unavoidable. The COVID-19 pandemic has also impacted our operations, resulting in staff scheduling and recruitment challenges. We work diligently to ensure that staffing levels are maintained to provide high-quality care in light of these shortages. Westminster Place uses temporary help as a last resort. Our residents will end up bearing the financial burden of this proposed ordinance, which we expect could be well over $250,000 per year. Please do not allow the proposed ordinance to limit employers' flexibility in setting worker schedules to move forward. Thank you.
Thank you. Next, we have Nadim Abi Anton, followed by David Erickson.
Good evening, and thank you, council members and committee for allowing us to speak tonight. My name is Nadim Abi Anton. I'm the Chief Executive Officer of Presbyterian Homes, a nonprofit and long-term care provider in the Evanston market since 1920. We serve 470 residents with 416 employees on the west side of Evanston. Again, I appreciate the opportunity. As Bill has mentioned, we run a very complex 24/7 operation. We have struggled during the COVID time as well as post-COVID with the worst staffing shortage experienced in recent U.S. history. on a regular basis, we have 26 vacancies that we have to fill with 30% turnover and overtime expenses and agency use, which adds to the financial burdens that we already have experienced through COVID with increased expenses. And this ordinance, the Fair Workweek ordinance, is only going to add to those financial burdens of not just Presbyterian Homes, but all senior living providers in the Evanston market. We are still coming out of COVID from a census standpoint and a financial standpoint as an industry. As an example, our communities only took masks off on April 17th. So we've been really continuing with the COVID impact up until very recently. This financial burden will get passed on to our residents, just like it does with any institution that has these financial difficulties. And unfortunately, with significant competition in the North Shore and across city lines, residents have options of going outside of Evanston to jurisdictions that don't have this ordinance in place and will be able to provide services at a lower cost to those individuals. Appreciate your consideration and hope you support us in preventing this from moving forward. Thank you.
Thank you. Next up is David Erickson, followed by Pamela Staples.
Good evening. I'm David Erickson, General Counsel for Covenant Living, which operates Three Crowns Park in Evanston. Three Crowns Park has been serving residents of Evanston for over 100 years. I'm also here to express my concerns with the Fair Workweek ordinance, as Nadeem and Bill Casper have also expressed. We're, as a nursing care facility, we have 24-hour staffing requirements that is governed by Illinois Department of Public Health and also the Centers for Medicaid and Medicare Services. And the Fair Workweek ordinance does interfere with the 24-hour staffing that we are required to maintain to match census and acuity of our residents. Also, the Fair Workweek does add additional cost that would only be passed on to our residents at Three Crowns Park. And for that reason, we have concerns about this ordinance, and we ask for the life care facilities and nursing care facilities to be exempted as this discussion moves forward. Thank you.
Thank you. Pamela Staples, followed by Stephen Vick.
Well, actually, we're together, so do you mind both of us coming at the same time?
You can come
Would
up.
that be okay?
Sure.
Come on.
Want me to start?
Good evening, everybody. My name is Stephen Vick. Thanks for having us tonight. I'm the Executive Director of the Infant Welfare Society of Evanston. We've been here since 1913, and we're speaking tonight in support of one of our employees that we're hopeful to rename the Pittner Alley after her, Geraldine Jerry Pace. And I want to read a short note, put it in the record. I'm speaking on behalf of Geraldine Jerry Pace and the amazing commitment and contribution she has made not only to the Infant Welfare Society, but to the entire community and city of Evanston. Jerry has given 48 years of her life, I'll repeat, 48 years of her life as a teacher, educator, caretaker, nurturer, and friend to our organization and the city residents. She has served 3 generations of families that have come through our doors. Most of our families from the beginning of our operations of 1913 have been low income, high needs families. Many of our families are struggling with poverty, housing insecurity, food instability, low wages. Teachers like Jerry provide safe, stable, caring, and loving support for these families to ensure that their children are developing socially, emotionally, and beginning language acquisition and improving fine and gross motor skills. The rigors of being an early childhood teacher are very demanding. It is incredible to think that Jerry has been teaching for 48 years and stayed with our organization the entire time of her long and impactful education career. On behalf of IWSC Board of Directors and myself, the current Executive Director, we thank Jerry Pace and hope the City of Evanston will recognize her achievements and accomplishments in the field of early childhood education and rename the Pittner Alley to the Geraldine Pace Alley. Thank you.
Hi, my name is Pamela Staples, and I'm the site director of Baby Toddler Nursery child care program of Infant Welfare Society. And I just want to piggyback from Steve. Jerry is actually a long-term resident of Evanston. She grew up, she was born and raised here in Evanston. She raised her daughters here in Evanston. And she's also, she's a product of Evanston Township High School. She graduated in 1972. She was one of the highest, her graduating class was one of the highest graduating students to this date. So I just want to say, if I will read a letter from one of our parents who just gave a few words about Jerry. She says, "Dear members, I am grateful to have Jerry Pace in my life, as well as my children and grandchildren. In my eyes, I consider her family. I am forever grateful and thankful for her patience and the guidance she gave to my family, and could not have done it without her. All my grandchildren were in her classrooms, the baby, toddler, nursery. When they left the program, I felt they had all the skills needed to enter preschool and kindergarten. Jerry is the best. She deserves every bit of recognition bestowed upon her. Thank you." Thank you.
Thank you.
You're welcome.
Next up, we have David Merlette, followed by Sandy Johnson.
Good evening, council members. My name is David Merlette. I work for Mather, and I represent the Mather Evanston. The Mather Evanston is one of 3 not-for-profit life care communities in attendance this evening, and we are present to oppose the Fair Work Week ordinance. The Mather Evanston represents 335 resident constituents that will have to pay for the cost this ordinance imposes, while this ordinance does little to address the incredible challenges we are dealing with because of the great pandemic and the great resignation. There are many things about this ordinance that is not helpful, but with my time limited, I will speak directly to the impact it will have on our ability to offer sufficient and safe care to our most vulnerable residents that live in our licensed health care centers. While much appears to be back to normal, COVID still exists, and we still have employees call out sick every day. For the safety of residents and employees, and the fact that we are a healthcare institution defined by the Evanston Health Department, we follow their guidelines to ensure exposed employees stay off work long enough not to expose others. Our industry has been dealing for some time with a shortage in caregivers. The Great Resignation created a severe shortage in caregivers in all types of hospitality service positions. Our nurses and direct care team members work tirelessly to provide exceptional care to our most vulnerable residents. We must comply with the Illinois State Department of Public Health staffing requirements and follow COVID protocols as required by the Evanston Health Department. The Mather averages 6 call-offs each day, and most of these must be filled quickly. We strive to fill every shift with our own employees, who we know are highly trained and trustworthy, but it's not possible to wait 24 hours for a part-time current employee to decide whether to work. We must have enough care staff to keep themselves safe from injury and burnout and ensure the residents' health and safety is not in jeopardy. We take issue with the provision that we offer all current employees 72 hours before we recruit for an open longer-term shift. We post every open shift position internally and prefer to give to our own employees. However, we can't delay 72 hours. We oppose this, and we hope that you will consider the exemption for life plan communities and the nursing homes similar to the hospitals. Thank you for your time.
Thank you. Next up, we have Sandy Johnson, followed by Sydney Cohen.
Thank you for giving me the opportunity to speak tonight. I'm Sandy Johnson, and moved to Evanston 54 years ago, and I'm currently living in the First Ward. I'm speaking this evening regarding the proposed amendment to the City Code to create an Evanston Fair Work Week ordinance. I believe that all workers deserve healthy, predictable schedules, but also believe that all residents, even those of us who live in life plan communities, need a safe environment. I moved to a life plan community, the Mather, after a great deal of research 3+ years ago, just before the pandemic, after coming up with 4 priorities. 1, I wanted to remain in Evanston. 2, I wanted to be in a safe environment. 3, I wanted to be in a community where both residents and employees were valued. And 4, I wanted to be sure that staff would be available to care for me until the end of my life, even if I need nursing care. I have observed my life plan community meeting my 4 priorities during my stay, while the 4th priority is often challenging. All staff members within the organization are valued, and flexible scheduling to accommodate personal needs is available. There are times when staff become ill or leave for an emergency situation, and agency help may be needed to ensure the safety of our residents. Our nursing units provide skilled care to residents who may need oxygen, tube feedings, etc., and can't be without a caregiver for 24 or 72 hours. Agency help may be required in such instances. If staff members are not available, it would be a disservice to both employer and residents if fines would be imposed when agency help could fill the need. Residents would have to cover the cost. I call on the members of the Human Services Committee to exclude life plan communities from the proposed ordinance to ensure the safety of senior residents in our community.
Thank you. We have Sydney, is it Cohen? Cohen, followed by, I can't quite read this name, Diane Petersmark.
Hi there. I'm a Northwestern graduate and the former president of Students for Sensible Drug Policy at Northwestern University. I'm here today to speak in favor of a proposal to craft an ordinance that would decriminalize entheogenic plant use. So, to create a criminal, you have to create the crime. We must have had a pretty good reason then to create criminals out of entheogenic plant users, right? So maybe it would make sense to criminalize the use of these plants because they're a detriment to human health. But evidence shows psychedelic fungus is well regarded to be the least toxic drug known to man, associated with no clinical deaths. Then maybe we criminalized it because they're associated with an increase in crime. But recent evidence, as recent as 2022, shows that psychedelic substances and the use of them is associated with lower odds of crime arrests. Considering our country has the highest rates of incarceration globally, this is not an insignificant finding. So, like other criminalized substances, entheogenic plants must be dangerously addictive and offer no health benefits. Yet, not only is currently available evidence showing entheogenic plants do not result in dependence or addiction, but there has been a myriad of studies showing therapeutic use of these substances is actually associated with treating addiction, specifically of tobacco and alcohol abuse. Additionally, these entheogenic substances are showing a lot of promise in treating treatment-resistant depressive disorders and anxiety disorders. Now, the case for criminalizing these substances seems rather flimsy. Even still, the measure we discussed today keeps these substances regulated and simply stops persecuting people for possession or use. These plants would not be available for commercial sale. This means that Evanston can reduce unnecessary policing efforts and pave the way for future research into this class of drugs in clinical and therapeutic settings. Following Ann Arbor's similar decriminalization effort, which was unanimously passed by their council, they cited the recent $17 million initiative by Johns Hopkins to further research in this area, as well as evidence that psychedelic substances can be used to treat substance abuse disorders, including the current epidemic of opioid abuse. So let's encourage the pursuit of human liberty and decriminalize entheogenic plant use. Thank you.
Thank you. Diane Petersmark, followed by...
It's probably Norm Weston.
Norm Weston, okay.
I live at Sherman Gardens. My name is Diane Petersmark, and we have a rat problem. And I wanted to make a comment about the rodent control plan that is being submitted to this committee. I think over the years we've worked with feral cats on our property, and they work. And there are other natural solutions to the rat problem. One of which would be to keep your garbage area clean, which the restaurant next door to us does not do. And I guess what we're saying is that I would like the Health and Human Services Department to consider more natural ways of controlling rats, because what they're doing now is not working. Rats are a big part of our lives here in Evanston, and they shouldn't be that big a part of our lives. They can be controlled. So that's basically it. I hope that we can get some natural stuff in. Thank you.
Thank you.
Thank you. I'm Norm Weston, and I live at Sherman Gardens Apartments, same place where Diane lives. And the idea of watching rats crawl around every night, which I can see out my office window, I'm on the second floor, and my bedroom window, second floor, and all I need to do is open up, and within 15 seconds, a tiny bit, I see rats. And I can look down into an open dumpster, and they're very visible with white bags with the rats crawling all around them. And this goes on all night. So we've tried a couple of different times to have this addressed, working with the city. They've come out, they've spoken with the restaurant. Whatever they've said to them is not being done. I really appreciate the work of Greg Olson and his group, who are going to try to take this stuff on in-house. And I have to say that I filed 2 complaints. We got immediate response. People were talked to. Well, the rats are still there. Nothing has happened. So I'm asking you to support Greg and his efforts. And actually, we love that restaurant. And we want to be good neighbors, and hopefully they will as well. Thank you.
Thank you. Next up, we have Dorothy Mahoney. Okay. All right, that is everyone who is here signed up in person. We'll go to our online sign up, and we are looking to see if Percy Berger is online. I see them online. You can unmute yourself.
Yes, I am. Thank you very much, Chairman Hedekais. My name is Percy Berger. I'm an Evanstonian of a little over 52 years, and have been previously affiliated with an integrated healthcare system at North Shore for a period of time, more than 22 years, and that since that time has been retired and doing other things here in the city. I've raised a family here, and all of those members of the family took advantage of the great opportunities, resources, and services we have in Evanston. I am here to support the ordinance for the Fair Work Week, but with a couple caveats. First and foremost, I think everyone deserves a equal opportunity, a fair opportunity to work, to be paid reasonably, and to be receive fair and equitable treatment with respect to employment. So therefore, with respect to the covered industries, the industries that most of the other parts of the country have uniformly included, which included the 2 key ones that we have included, I support those items. However, and those items, however, I don't support the package in total. The ones that are not supported are the ones with respect to nursing care, nursing homes, and with respect to child health care. While technically child care is not an industry that many of us who don't have kids engage with, it's one of the most important areas of most people's lives. The beginning, where we want the very best for our kids, including child health care, child safety, but also in the waning years, the other end of the spectrum, that people here have spoken so eloquently about with respect to nursing homes that take care of us in various ways at the downside of that cycle. The integrated healthcare systems cover you in the middle of that cycle. They both work well together. And the other systems, the other states around the country, the other municipalities who have accepted predictive scheduling did not include, almost all of them to a letter, did not include these two. And I think those two should be excluded. They are sufficiently governed by state, county,
Thank you, Mr. Berger.
and federal agencies. We don't need to add an additional level to child care or to nursing homes of any category, and I think they should be exempt in that regard. Thank you.
Thank you, Mr. Berger. Next up, we have online, we have Malika Gardner. Is Ms. Gardner in the Zoom? We will come back to you if you want to later. Next up, we have Bernadette Burke. Okay, it looks like we are at the end of our list for public comment. Thank you all for sharing. We will move on to our scheduled agenda. Is there a Ben Ruddle online?
Yes, hi, that's me. Good evening. My name is Ben Riddell. I am the Director of Criminal Justice Policy for the ACLU of Illinois. Thank you for the opportunity to speak this evening to the proposed ordinance sponsored by Councilmember Reed to decriminalize psilocybin and related substances for therapeutic use in Evanston. Passing this ordinance would be a small but meaningful step toward dismantling the set of policies we know as the war on drugs. Today in Illinois, it is a felony for anyone to possess any amount of psilocybin, a substance that's been proven by research to have substantial therapeutic benefits for people suffering from illness and trauma. But this is only one small example of the cruelty of the drug war. Since cannabis was legalized in Illinois, some people have begun talking about the drug war in the past tense. But in 2023, we continue to incarcerate thousands of people every year, separating families and burdening individuals for the rest of their lives with criminal records and making it more difficult for them to access employment, housing, education, and healthcare, all just because they use substances. These laws are applied inequitably. While drug use is a reality in every community, the enforcement of our criminal drug laws falls disproportionately upon Black people and upon residents of lower income neighborhoods. While there's no debate that sometimes drug use can be very harmful, jails are not treatment centers. Incarcerating people with substance use disorders worsens their health outcomes. While many incarcerated people need care, the vast majority will never receive it. Community-based treatment can be provided at a fraction of the cost of treatment in a jail or prison, and research has shown that voluntary treatment is far more effective than coerced treatment through the criminal legal system. If we really want to see fewer overdose deaths and less drug-related harm in our families and our communities, then we must turn away from ineffective and harmful strategies of prohibition and punishment. Our public resources should instead be directed toward increasing our capacity to provide health services and reducing barriers to accessing those services in all our communities. This ordinance is one small step in the right direction, and we urge your support. Thank you.
Great, thank you. And now I think that does conclude. right. We did receive a letter concerning the Fair Work Week. I can kind of give from, let's see, SEIU Healthcare Illinois, from the Vice President and Director, Shaba Andrick. And they wrote to us, and I will summarize, to ask for us to remove nursing homes from the Fair Work Week ordinance. That's something that I've forwarded on to the other members of the
point of information. I think it was the exact opposite of that.
Yeah.
Was it? SEIU does not support us removing nursing homes. They would like us to keep it in, and that is what their argument is.
Oh, is that? Did I read that wrong? Okay, I apologize.
If I can quickly summarize the letter, I'll just read the last two paragraphs here quickly. It is so they support us keeping nursing homes in, and they say it is crucial to consider the financial burden on workers themselves. While the letter there, this is in direct response to the letter that we received from our nursing home institutions. While the letter implies that residents will bear the financial burden of the ordinance, it is essential to recognize that nursing home employees, particularly non-unionized workers, often face challenging work conditions and low wages. According to data from the U.S. Bureau of Labor Statistics, the median hourly wage for nursing assistants in 2020 was $14.82, which is below the living wage for many families. Implementing the Fair Work Week ordinance can help alleviate some of the financial pressures that these workers face and create a more equitable workforce. In conclusion, the Fair Work Week ordinance has the potential to benefit both employees and the organizations they serve, especially for non-unionized workers who lack the protections provided by union contracts. By promoting stability, predictability, and fairness, this legislation can contribute to a healthier workforce, improve care for residents, and increase employee satisfaction. The SEIU urges the Human Services Committee to move forward with the ordinance and consider the long-term benefits it can provide to the community from the workers' perspective.
All right. All right. Thank you. I think that, do we have anything else in late emails? So that brings us.
Is it possible for me to speak?
Sure.
I'm sorry, I was called earlier.
Okay.
My name is Bernadette Burke, and I was called earlier, but the Zoom did not let me in.
Okay. You can start.
All right, thank you. I am Bernadette Burke. I am president of Brella Productions. We are located in the 5th Ward of Evanston. We've been in the city of Evanston for about 30 years now. And I'm here to share my concern with the Fair Work Week ordinance. My organization is not affected by this ordinance directly, but I am concerned on behalf of the small businesses with 50 to 40 employees. This size group of employers is frequently challenged since they often do not have dedicated HR team members or administrators beyond the owner. And I ask that this ordinance be rejected, or if enacted, that the minimum employee count be in alignment with the city of Chicago, which is 50 employees or greater. And that's it. Thank you so much for letting me speak.
Great. And I guess I will do one last check if Malika Gardner is in the Zoom. Okay, so that concludes public comment. We'll move on to the rest of our agenda. I will make a slight administrative change, and I will ask for someone to move forward HS 5.
I move ordinance. Oh, okay. I move ordinance HS 5 establishing Evanston's Fair Work Week ordinance. And I just want to note a point of information or order for for Ben from ACLU. I hope you're able to stick around in case some of my colleagues have questions about the decrim policy. But I move ordinance HS5, ordinance 24023, establishing Evanston's Fair Work Week.
Second, this is Councilmember Burns.
All right, we have a second, and we'll open the floor for discussion. Councilmember Reed.
Thank you. The time is up already. All right. I did not expect this to be first, but I'm really happy that it is because of what today is. It's May 1st, and today is May Day. It's a day that we recognize the struggle for workers' rights, and that struggle beginning right here in our own backyard in Chicago, our neighbor to the south. And so this is an ordinance that, as folks know, would create a stable, predictable schedule for Evanston's workers. I believe that it will, in fact, help curtail some of the staffing issues that many industries are facing. And so, we've seen this a few times before. At this point, I would really just like to hone in on a few questions, and I would love to hear, particularly from our nursing home industry. I feel like there's a lot of misunderstanding and misinformation here, because I've heard numbers and timelines thrown around that don't seem like they comport with what this ordinance does. And so I would love for any of the providers to say specifically what provision in this ordinance you are most worried about and most concerned about it. If I'll have any volunteers, I see you're kind of moving, so please, I would invite you up to the microphone to provide some clarity.
Good evening again, and thank you for the opportunity to come back and clarify. We are in a healthcare environment, so our staffing is very census-based. So we have to staff levels of employees according to the number of residents that we have. So no differently than hospitals, we get admissions with very short notice, 2 to 3 days. Residents and patients have options, and so many times we get called on a Friday that we have 3 or 4 residents coming in to receive rehab in our facilities, and so we have to staff up. As many of our colleagues have said, so that's one is the staffing, the census timing.
I'm sorry, can you, what about the ordinance wouldn't allow you to?
The 14-day notification period for schedule changes is an issue for us. Because many times when we only have 2 or 3 notice days of when we have admissions coming into our community or residents coming or leaving, the duration of the notice period for schedule changes is an issue for us. So that the 14-day is an issue, 1, in terms of admissions and discharges, and 2, in terms of call-offs. With COVID, we serve a very frail population. And as you can imagine, we don't want people coming sick to cause our elderly to get sick. And so we have a lot of call-offs. We have a flu season that starts on October 1st and ends on March 31st per IDPH, so Illinois Department of Public Health. So if somebody is sick during that time frame, and Ike, you can probably, that regulation, we only got a call the day before. No one, the 14 days is a big issue for us because our business doesn't operate that way. In order to protect our residents, we have to make schedule changes. When an employee calls off, we have to replace them. We don't have the option of not replacing them. So that is our concern. We're not different than hospitals as far as staffing is concerned because we deal with a population that does change and we have to staff accordingly. Thank you.
Okay.
Sorry, I didn't mean to.
No. That is helpful. I think I still am not directly hearing how this ordinance prevents you from being able to meet those needs. Yes, this ordinance would require that you give workers their schedules 14 days in advance. And yes, if someone were to call off within 24 hours, you would be mandated to, if you needed to fill that gap with an employee who was not scheduled, you'd have to give them time and a half. But I'm still not exactly hearing how this ordinance would prohibit you from providing the care that you need. And what, and I don't know if any of the experts that we worked with on this are on the call, but what the researchers have found is that oftentimes these Fair Workweek ordinances lead to fewer call-offs. And lead to workers, because of their schedule predictability, fewer call-offs and more stability both for the worker and for the agency. Now, granted, as folks have mentioned, nursing homes are not included in every ordinance, and so there could be some variance there that's unknown, but across the board, when this has been researched, it has led to more stable.
Well, we respectfully disagree with the research because we post schedule. No one wants more predictability in the schedules than we do. We post schedule 6 and 4 weeks out for our employees. We follow every guideline in terms of trying to give them predictability. We work with them on those who want part-time work. I just mentioned earlier, we have 36 vacancies as of today. So we want to have full-time employees come work for us. The problem is that there is unpredictability. As much as we try and plan ahead, there's always unpredictability in the schedule, especially now with an over-alertness on infection control and asking our employees more so than ever to stay home if they're sick. I think that adds to the census challenges and the unpredictability of our census. So that is our position and how we operate. Thank you.
And I can ask this to you or anyone. If there was a healthcare emergency, are folks treated at your facility or are they treated somewhere else?
It depends on the situation. We have clinical teams, nurses and CNAs and nurse practitioners. So in many cases, we try and avoid hospitalizations or rehospitalizations for our residents, and we have many direct admits where we work with the medical staff. As you can imagine, the last year with our hospital systems being overwhelmed, we've really served as a secondary care area for hospitals. So they were discharging to us a lot sooner than they would normally do because they wanted the beds to provide care for more critical cases. And so we are an extension of the healthcare system.
Thank you for that. And last question for you here is, do you know what the average wage for your, ground level employees?
Our minimum wage at Presbyterian Homes today is $17 an hour. And our clinical teams earn higher than that. But that is the starting point. And I will tell you that we have very few. These are high school kids who work after school in our dining rooms that earn $17 an hour. Our CNAs, our nurses are much higher than that. CNAs on average earn about $22 an hour.
Okay, thank you for that.
Thank you so much for the opportunity.
Yes, thank you. I will certainly certainly am happy to hear feedback from other colleagues. I am prepared in the, certainly we heard feedback from folks who were in the healthcare industry. We took that feedback into consideration, understood the unique challenges there and made an adjustment to this ordinance. So I will leave it there and certainly happy to hear feedback from colleagues.
So I have one quick question from some of the audience members. One of you mentioned being nonprofit status, and can you kind of expand on the nonprofit status and how that works in your facility?
Speak of that, and I have a couple concerns about other provisions in the ordinance that I'd like to at least respond to. All of our communities are not-for-profit communities. We don't have a set of investors or stockholders for our businesses. So we operate, and the dollars that the residents that live in our communities pay for the services, they pay for the operating expenses, and they pay for the capital expenses, and we try to balance out basically at zero net income at the end of the year. The couple things, the provisions that I'm concerned with, in addition to what Nadine mentioned, is the 24-hour notice for all part-time employees to fill an open shift. There's no way we can comply with that. We have to, when a shift comes open, we have at the Mather about 6 open shifts every day, and we have to meet minimum staffing requirements by the State Department of Public Health. And if a shift comes open, we're naturally going to try to fill that with our own employees. But if they're not available, we have to call a temp agency immediately and get people in to fill those shifts. There's also a 72-hour notice for longer-term shifts that are available that are going to be more permanent. Again, in this staffing crisis and the severe shortage of nurses and CNAs, we have to kind of do both at the same time. We know who our employees are that have part-time availability, and we certainly strive to offer up them more shifts long-term. We want all of them to be full-time for us. But we also have to simultaneously start recruitment efforts. There's only so many people out there looking for jobs, and they're shopping a lot of organizations, and you've got to be prepared. So those are 2 areas that, the way I read the provisions, there's no way that we could possibly comply with.
Councilmember Hericares, may I?
Sure, Councilmember Reed.
Respond to that. Thank you for raising that. And I think this is an example of where there are genuine concerns, but also genuine confusion here. There's nothing in this ordinance that would prohibit you, from my understanding, from, if you received notice in less than 24 hours that there was a call off, the requirement is just that employee who is going to come in to fill the shift would be paid time and a half for the less than 24-hour notice. So certainly, and Allison, do you want to provide some clarity here?
Hi, good evening, committee members. My name is Allison Leipziger. I'm the policy coordinator. I just want to clarify a few things on this. First of all, if an employee calls off less than 24 hours, then the person who you call to fill that shift would be paid 1 hour of predictability pay, so not even time and a half. They'd be paid 1 hour of predictability pay. This means that if you're making $17 an hour and you're working 8 hours, you get $17 times 8 plus another 17. You just get paid for 1 extra hour that you haven't worked, but you're being compensated for that last minute change. The filling the spots in 24 hours or 72, that's for hiring, not for filling a shift. That's for hiring new employees. So that provision says that if you want to hire a new worker, you have to offer that position to everybody who's a part-time worker before you go out to the general public. Because, and this is not to say that any of these organizations do that, but that provision is to prevent employers who do, they look to hire only part-time individuals instead of offering it to their existing part-time employees to avoid paying for benefits. Again, I'm not saying that that's what these organizations do by any means, but that's what the provision is meant to prevent. It doesn't apply to shift changes. It's only for hiring new staff. And if I could just talk really quickly in general about the ordinance, because we haven't quite done that yet. So let me just give a very, very quick overview, if that's okay. First, the ordinance gives a right to predictability. So that says that employers have to give 14 days notice of what the schedule is going to be. And then any changes that come up within 24 hours, a person gets paid predictability pay, which is just, again, another hour of work that they haven't done. It's to compensate them. The second provision, the main provision, is the right to additional hours. Again, instead of hiring more and more part-time employees, going to your existing part-time employees first. That's when you have a set amount of time to offer those hours. And if your part-time employees don't respond within 72 hours, then you can go out to the public. They've been given an opportunity. They didn't take it. You're allowed to hire more folks. And then the third is the right to rest. So if you close a shift and then you're next to open it, that there's like 11 hours in between when you sign off work. You can go home, you can sleep, you can shower, do what you need to do, and it's 11 hours until you start again. The other thing I want to mention, and you're compensated if you work less than 11 hours.
That's where time and a half comes in.
That's where time and a half comes in, that's correct. And any employee-initiated changes don't qualify for any of these provisions. So if I'm an employee and I say, hey, I want to change XYZ, I don't get compensated for the changes that I make because they're on me. It's really to help the workers who are told last minute, you've got to do this, you've got to do that. It still allows the employees to have the flexibility that they need. They just get compensated for last minute changes.
Thank you, Allison.
Thank you.
So,
Councilman-
Allison, I just
Councilmember
another
Revelle?
question. So, could you talk about the paperwork or whatever that goes
Sure.
into,
Sure.
demonstrating compliance?
So the day-to-day, the ordinance just says that a lot of these things have to be in writing. So you can't just verbally say to somebody, can you come in, can you come in, can you come in? But in writing can be a text, an email. It does not have to be anything beyond that. Then there is one of the last provisions in here is, let me just pull it up, retention of records. And it says you have to keep these things for 3 years. So if you take a screenshot of that text or you keep that text, that is keeping that record for 3 years. There's not, a ton that has to go into it beyond just having those conversations and not throwing them away. I think that it's really a protection for the employer and the employee, but it does not have to be super onerous. But, I get that it's unattractive.
Great, thank you. Do we have any other questions up here? Mr. Merlette, have a statement?
A couple more questions. First of all, I've heard a couple of times that specialists that worked on this consulted with healthcare professionals. The Mather organization never received any call from anyone to consult on this ordinance put together, so I'm not sure who y'all consulted with. I think this is written poorly at best. If you go to Section C, number 2, it says, when the covered employer's offer of additional work under this section is for an expected duration of 2 weeks or less, the part-time employee shall have 24 hours to accept the additional hours, after which time the covered employer may hire new employees to work the additional hours. How are we supposed to read that? If we have a shift available that's less than 2 weeks, we have to wait 24 hours to give our part-time employees to cover that. So this is unclear the way it's drafted, the way that we've read it and our other life plan communities have read it. It's very unclear. So this leads us to believe that if we have open shifts, our part-time employees, we have to give them 24 hours before we can fill those. So I raise that question. And then also, there's just no way we can't start recruiting efforts for new employees and give 72 more hours. You can't hire someone if you're not ready. Every organization is trying to condense the time from recruitment to hire because you lose people to other organizations every day. It took us 4 directors of nursing to hire this last year. They accept the job and they get another offer from someone else the next day. So it is a difficult environment to staff and to provide care right now. This is not going to help us.
Allison, do you have can you answer that question around the 24-hour scheduling? I think you already did, but.
Yeah, if you're offering that shift to an existing employee, you do not have to wait 24 hours to do that. If you're looking to hire somebody part-time, a new person part-time, you have to offer it to your existing part-time staff first, and they have 72 hours to say they don't want to be full-time, essentially. So if it's a shift that you're trying to fill, you can fill that in 5 seconds, or, you can fill it immediately. But if you're looking to hire someone part-time, you just have to ask your part-time employees first, and they have 72 hours to respond to you. But those are for new employees, not shift openings. So shift is existing employees, hiring is new employees.
Great. Thanks for the clarification. Councilmember Reed.
Yeah, and specifically to that section C2, is that what you just referenced there? That would be maybe before you go out for a long-term temp, potentially. That 24-hour period, if you expect the work to last 2 weeks, to me seems to would cover a temp agency being hired to cover that 2-week period. You'd have to offer that to employees first. So just for even more clarity there. I am supportive of, this is here for action. I encourage us to move this forward to council. I hear the concerns of the nursing industry. And maybe there are, and so I hear those concerns, but I think this, particularly since these are employees who are not minimum wage employees, but on the lower end of the wage scale, that these are particularly the employees that we're looking to protect and make sure that they have firm rights. And I maintain that with this Fair Work Week ordinance in place, I believe Evanston will be a more attractive place for workers in the nursing industry, in the restaurant industry, retail, across the board. And I believe that it will increase the level of service for our seniors and for the folks living in these long-term care facilities. In the retail spaces where these ordinances have been researched, it shows a substantive increase in worker morale and profit for, in fact, in retail studies. There's a study done at Gap. Was it Gap or Old Navy, Allison? Do you recall? One of the two. I think they're both owned by the same folks either way. And there's a study done there where they applied the Fair Workweek treatment to some Gap stores, and they left things the same at other Gap stores. And what they found is that the Gap stores where the Fair Work Week ordinance was, or where a version of this was in place, those stores had higher sales. Those stores, the workers reported having a higher morale. And so there's a benefit both for the and there is a cost savings to the employer. With this, not only an increase in sales, cost savings, greater worker morale, and I believe also that even customer satisfaction, I may be fudging on that one a bit, but even customer satisfaction went up. And so, I see this having a lot of upside for for all of the covered industries, including nursing homes. I see this being a net positive. So, thank you.
Councilmember Ravel.
Well, there's another group of employers that we haven't talked about, but Mr. Berger mentioned them, and they are a concern for me, which is our child care providers. Those child care is not included, for example, in the Chicago ordinance, and we have one representative from the child care community here tonight. Allison, can you talk about how the ordinance would affect a child care, like Infant Welfare Society, for example? How would it affect them? And maybe we could hear from Mr. Vick about his thoughts.
Yeah, it would be the same as any entity. They'd have to put their schedules out 14 days in advance, and they'd have to pay an extra hour of pay every time somebody takes a last-minute shift. Those are the big provisions of it.
I know our childcare community is they have to
In
pay
a tight
pretty
situation right now.
close attention to every penny, and, I think, so I am a little concerned.
Yes, understandable.
I don't know, I don't want to put you on the spot, Mr. Vick, unless you'd like to comment. No?
This is the first time I heard of the ordinance, so I wasn't even prepared to speak on it. But so, from my understanding, what you're saying is that, A, we have to notify our internal staff first, right? If we're hiring. Part-time. Okay. And then the issue that you just brought up, just to clarify, you're saying that we have to, if we have a shift change, we have to provide 1 hour of pay if it's within 24 hours. Obviously, we have a huge challenge with staffing right now, right? And we're struggling with our staff coverage, where we've even had to close classrooms because of our coverage. A lot of times, we do have to have notification of staff. So, I think that would impact us, if I'm correct, Pam, where we would have to let someone know that they have to make a coverage for someone who's out or sick or what have you, and that would cost us additional dollars.
Yes, and we actually do our schedules a week at a time. So I know if I need somebody on call, I would already put that person on the schedule for on call. So they're aware that they have to work, like a Tuesday or Wednesday. So they're already aware of it.
But you said it's a 2-week notification.
But that's not necessarily in childcare. It's a little bit different.
Mm-hmm.
So we let them know in advance that they have to work.
Yeah. Well, I think it's concerning that we haven't reached out to the childcare community to discuss this
This
ordinance.
is the first time I heard of this ordinance, and I was here for another issue. So.
Right. No, I know it. Yeah. When I saw you, I thought, oh, good, he's here for Fair Work Week.
Okay.
Right. Well, I am concerned about including childcare in our ordinance, and I would move to amend the ordinance before us to exempt our childcare community.
Councilmember Ravel, if you can send that in an email, please. Sure. I think. Councilmember Reed.
Yes. Yes.
And my hand is up, Chair, just
Go
so
ahead,
you know.
Go ahead, Councilmember Burns.
How does the ordinance treat someone that is on call, was just described a moment ago? So they're aware that they're on call, for certain days, and so it's not like it sprung on them, with less than 24-hour notice because they knew a week in advance that they were on call for specific days. How does the ordinance deal with that?
Yes, correct. They're already aware that they're expected to be on call. My understanding is that they would not be paid predictability pay.
However, just as a point of information, if they were in fact not granted the hours that they expected, there would be a penalty. So if someone's on call, they're expected to receive those hours, and the only time the worker would receive additional compensation is if in fact those hours were canceled.
Correct.
Right, because that's the point of this. We want workers to know what their pay is going to be 2 weeks in ahead, and if you're just putting people on call all the time and then you're not having them come in, that is exactly what we want to avoid to ensure that folks are making predictable wages.
Right. So one of the reasons that these ordinances are so important is because what some people will have to do if they don't have that predictability is that they're not able to schedule time at their other jobs, or they're waiting around to find out what their schedule is, or they're told that they're going to work on Tuesday and Wednesday, and then they get canceled last minute. I don't think that happens as often in like childcare and nursing homes, but in retail, for example, which is why retail is kind of the main thread among all of these ordinances. People will be told last minute, actually, we don't need you on Wednesday and Thursday. And then they have already paid for childcare. They haven't taken hours at their second job. And so they would be paid again for that change, that last minute change in those situations. So.
Thank you.
Did that answer your question?
Yeah, I'm going to go out video because I think I'm lagging a little bit for some reason. So hopefully you can still hear me. So less than 11 hours petition. Going back to one of I heard something else earlier, and it seemed like the gentleman who spoke, I'm not quite sure the company or organization he was from. I think it was one of I'm not sure what the organization he was from. But I think his concern was the amount of time that an organization or company would have to wait to hear back from an employee on whether or not they wanted to take on that additional work. And so I guess my first question is that the concern? Because our response did not seem to address his concern, if I understood it correctly. And I just want to make sure that we speak to that. I thought it was, yes, here's the opportunity. We're going to offer it to an existing employee, but we have to wait either 24 or 72 hours, depending on the circumstance. And it's that time that you have to wait to hear back from them that was a concern. So again, one, is that, to the gentleman in the room, is that the concern? And then two, I just want to make sure I hear a response to that.
Yes, that was.
Okay. Mr. Merlet?
Yes, thank you. Yeah, that is a concern. I'm almost 100% sure we know every one of our employees, if there's any opportunity for them to pick up other shifts, or to increase their hours permanently. That's been high priority for 3 years. And we, as well as I know our two fellow organizations here, have hired employees that were working part-time for us and they were working part-time for other organizations. We basically offered to pay them a lot more just to come work for us, whether we had the hours or not. It's been whatever it takes to bring our employees on full-time and to retain them. So to ask us to wait 72 hours when we already know which one of our employees, all of our employees, whether they're willing to take on more responsibilities, is a waste of 72 hours. So that is just not smart right now for us. And I do have to ask the question. The Evanston Health Department has considered us healthcare facilities for many years, just like hospitals are healthcare facilities, right? We provide post-acute care. Hospitals provide subacute care. How can you tell me that you would exclude hospitals, but you don't exclude us? We're as regulated, if not more, than hospitals for staffing ratios. It doesn't add up. So I'd love to have that question answered if that's possible.
If Director Ogbo, could you answer that question for us?
Well, Councilmember Burns had a question on the floor. If we can start with what.
Okay.
Yeah, I'd like to take that question first about the 72-hour period, which is nothing in this ordinance would prohibit you from, if you, within that 72-hour period, one of the employees who you know well says, yes, I want to go from 30 hours to 35 hours, bam. You've filled that vacancy, and you don't have to wait any longer because that employee who's already employed has agreed. So you wouldn't be impacted there. And then, so I'll just answer that, and then Director Ogbo.
But if Councilman Reed, but if they
Sure.
say, if that employee says, well, wait, let me think about it for the 72 hours, then you have to wait the 72 hours, correct? Is that?
Sure.
Because obviously that's what it's for.
Sure, but
or
nothing.
we would have it at 24 hours instead of 72 hours. We're saying that they have that full amount of time to come back and respond, presumably so that they could, work out, that they can have the time they need to figure out whether they can work it into their schedule, into their life, et cetera. But
Right.
I just want to make that clear that the employee could say, well, I need time to think about this. And you're you have to wait 72 hours until they get back to you.
Which I think is reasonable, right? If an employee is going to make that kind of decision about their life, that they're going to take on 15 whatever additional hours, I think it's totally reasonable that they would have a few days to make that consideration. And to be clear, nothing prohibits any business from within that during that 72-hour period from preparing everything they need to do to advertise the new position. So you can have your Indeed posting and everything else, wherever you post your jobs, you can have that ready to go at the end of that 72-hour period and be able to move very quickly after that period has elapsed.
Okay.
Thank you for that. I feel like what you just said speaks more directly to what the concern was, which is why I wanted to bring this back, because I don't think the response is, oh, well, yeah, if the employee says yes, then you can move forward. I think that's the best case scenario, and one in which everyone would appreciate if every situation resulted in such a quick response. But again, the ordinance would allow for more time, and I think it's that time if somebody wanted to take advantage of that time is where the concern originated from. So thank you for speaking to it more directly. That's all for now, Chair. I think I have a few other questions that I'm trying to figure out exactly how to phrase it, but I'll rest for now. But thank you.
Okay, thank you. Mr. Vick, you had a comment?
So as I said, this is my first understanding that there was this ordinance, and that maybe some ignorance on my part of lack of keeping up with the ordinances that are coming out. But to follow up with Councilmember Revelle, I would like to read the ordinance. We have an early childhood council of more than 40 members that I think would be more than interested to understand the ordinance. I don't know enough now to debate the issues, or I'd have to think about it more, but I think I guess this is more of a process or protocol question. I would think that you all would want to speak to the early childhood community and get our feedback or thoughts on this if it's something that might impact us. And it sounds like, from what Ms. Revelle said, that Chicago already exempted early childhood for a reason. So there may or may not be reason to exempt early childhood community. And I guess the question is, why is there a need to push this so fast through for a vote if there's an entire community that may be affected that may or may not have an issue with it? I don't know enough yet. But it would seem that if there's an existing council of 40 early childhood organizations, that we could look at the ordinance, give you some feedback and thoughts, and just try to flesh it out a little bit before there was a decision made. So that would be my question to this council, is why does there need to be a vote today if there's an entire community that may be affected that hasn't been engaged, which is kind of contrary to making decisions with the community, right? So I would ask this council to maybe pause the vote, or to reach out to the early child. I'm the vice chair of the Early Childhood Council and soon to be the chair of the council next July. I know our council would be interested in discussing this and reading the ordinance and having feedback and thoughts about it, because there's a lot of intricacies within early childhood, from full day, part day, different types of organizations that may have different impact. So I don't really have a point of yay or nay on the ordinance at this time. I'd like to read the ordinance. I'd like to talk with my colleagues about the ordinance and then give some feedback and thoughts. But it certainly sounds like if Chicago has exempted early childhood for a reason, there may be a reason that we want to exempt us as well in Evanston. So that would be my comment.
Okay, thank you. I'll weigh in a little bit as to where I kind of stand on this. The Fair for Work Week ordinance, I think, is really important for our employees, especially in kind of the retail area. And I think, we're seeing that there's a lot of intricacies around like certain specific industries that we really want to get right. One of the things that folks from the, nursing care industry reached out to me last Friday, and, I obviously don't know that much about how they operate. But one of the things, initially I thought this is like a healthcare like I kind of was wondering why they weren't included in healthcare, because there is, I think, the key component that like COVID is still here. And even though like I feel a little bit guilty that I'm not wearing a mask up here, it's still something that affects us, and especially our elderly community and children. And so I want to hear from Director Ogbo his take on nursing as a healthcare profession, the industry.
Yes. Well, the way that we view our long-term care facilities is that they have clinical capacity. There are a number of them who have units that are skilled nursing units that attend to our elderly and others. So the way that we also view it is that they are an extension of the hospitals, especially during COVID. We saw in many aspects of our response that they had COVID units where they were taking care of those who were sick, and even the hospitals in many occasions released them earlier because they knew that they would be taken care of at the facilities, depending on the level of illness of that individual. So we do have a number of facilities that are skilled nursing homes. The ones that come to mind now is Symphony, Aprion, Alden Estates, I believe, also has a skilled nursing unit within its facility.
Thank you for that.
Chairman,
do we have?
Chairman Hedekaris, Percy Berger, may I make a comment?
Sure, Mr. Berger.
We have taken a look at every city and state where child care was not included, and of all of the predictive scheduling that have been approved to date, only one included child care, and that was in fact San Jose, California, and in fact only two have included nursing care, and that was Berkeley and San Jose, and Chicago had some things about it, but no one went after these two industries except for two California cities, and Chicago has a modified program that it has. The other 10 or 11, and all of the ones that rejected it, no one included child care or nursing homes for some of the reasons that the Commissioner Igbo mentioned. Thank you.
Councilmember Reed.
Thank you. I want to note for us that the average, and this is from the Department of Human Services for the state of Illinois, that the reported that licensed family child care providers reported an average annual net income of $14,999 per year. 25% of family child care providers make less than $5,024 per year. And this is from the Department of Human Services for the state of Illinois. These are low-income workers. $14,000 a year is not enough to live in Evanston. That put you, some of us know, that would put you below 20% of AMI. I'm sure wages are maybe a bit higher at your facility, maybe quite a bit higher. But this is an industry that too often is taken advantage of. And again, not casting any aspersions toward providers that are with us, but it quite often is. And so I think to blanket remove child care is maybe not the right direction to go. I'll note that Berkeley is a pretty smart city, and now I'm thinking San Jose is maybe a pretty smart city. I think it is important to keep these workers who are least proximate to power, who oftentimes are not unionized, particularly when it comes to child care workers, do not have some of the protections that other industries have. I encourage us to keep child care workers and nursing homes. But if we, I'll note that, this will have 2 readings at council. So even if it passes tonight here, it's going to be another month or so before there's any final action taken on this. So I would continue to encourage us to move this forward, particularly given the significance of today being May Day. Move this forward today and have an opportunity to if folks want to make amendments today, it's certainly within their right to make an amendment, but we certainly will have at least two readings at council to make further amendments to this ordinance. Thank you.
Great.
I'm sorry. I actually have one question for any of the nursing home providers, if they happen to know this. What percentage of your employees are part-time? Sure. If you have a rough estimate.
I don't know an estimate, but the majority of our employees are full-time, and we do employ, I would say, 75 to 80% are full-time employees.
75 to 80%. Yeah. Does anybody else?
That's about right.
Sound about
And they're part-time because of choice.
Right. Yeah.
These are either high school kids or folks who have multiple jobs, and we accommodate them with a part-time schedule to make sure that that fits in their lifestyle.
Thank you.
I wonder if I could make just a couple of other points while I'm up here. Number one, I sort of want to just emphasize the point was made that these ordinances, I think, are really targeted to the workflow of a retail industry, and I think that there's a real mismatch in terms of the healthcare business model. We do not cancel people's shifts, and in the few instances in my career, which has not been a short one at this point, where we've ever had to cancel shifts, we, because of low census or just the changing occupancy, we have said, well, we ask people if they want to take PTO. We ask them if they want to take a day off. If they say no, then there's always, if there's there's an extra person on a day, there's always something that can be found for them to do. So we don't, in general, we do not cancel shifts. So we don't have, our challenge right now is finding enough people to fill shifts. To Director Ogbo, just one thing, all of the 3 providers here today do have post-acute skilled units also. And we work very closely with your health department, weekly phone calls, sometimes daily phone calls based on changing circumstances. Another thing I would say is, in terms of filling positions, all of our positions are posted internally before we advertise them. And in terms of, for example, CNA, Certified Nursing Assistants, we don't at any point in time in the last year not have Certified Nursing Assistant positions posted. So any of our employees who do want a position are able, or more hours, are able to easily apply for that. In addition to that, we also have a category of employees called occasional employees. We call them registry staff. They commit to us for 4 shifts a month, and then they agree to be available based on their schedule and based on their ability to fill it, for us to call them and ask them if they're available to fill an empty shift. So that, that's a total category of employees that I don't think is really addressed in the ordinance. And finally, I just want to in terms of the workflow issue, I really want to just make a point about the rest period that's in there. So, for example, if we have a full-time day shift employee and somebody calls in on the night shift, the first person that our staffing coordinator is going to call is anybody on the day shift who's interested in staying and working a second shift. So let's say a person accepts that. Our healthcare workers are on an 8 and 80 overtime schedule. So if that person works a second shift that day, they're already getting time and a half for that position. Now, that's not true necessarily of an employer that's on a 40-hour work week, but for us, that person's already getting time and a half. Now, that person will get done at 11 at night, but if they're a full-time daytime employee, they're going to have to be back at 7 o'clock the next morning. That's less than 8 hours. That means we'd have to pay them another 3.5 hours of overtime for them picking up a shift they willingly agreed to do. They said, I can deal with that. That's within my schedule. And in fact, and on top of that, even for the shift the next day, if they ended up, because of the night shift, the evening shift that they picked up, they go over 80 hours for the 2-week period, they're going to get time and a half for the final shift of that 10-day work week. So those our employees, we believe these are additional costs that would again, in terms of our population, be passed on to residents, because Medicare is not going to increase their rates for this, Medicaid is not going to increase their rates for this, and the rest of our residents are private pay. So I think those are some of the considerations that I just wanted to mention as a final point.
Thank you. As a point of procedure here, I have the amendment in writing from Councilmember Ravel, and I will ask if there's a second. This is to remove childcare from.
Second.
All right. Yep.
So far, just childcare.
Yes.
Yeah.
So can we take a vote on the amendment?
So I would like to discuss this. I think we just moved right to the vote.
Okay. Councilmember Burns.
I just want to say that I would love to allow time for Mr. Vick and members of the child care kind of industry time to review the ordinance. And so I'm not prepared to, with very little testimony from, or really nearly any testimony from that industry to vote on excluding them. I'm not big on making decisions just because some other municipality made them, and I don't know why they did. I don't think that's the best way to make decisions for a city. So I will be voting no, but I just want you to know why. I would prefer to see this held here than to vote with very little testimony from the very industry that we're looking to exclude. Thank you.
Councilmember Reed.
Yes. I will be. I appreciate the motion to remove the child care group. I think I too will be voting no, but I'm happy that the amendment is moving forward, and so happy to have a vote on that.
All right. And I think personally one of the things for me, like I said, the child care and healthcare in general, I think are still very impacted by the COVID pandemic, and this is also something we could potentially write a companion ordinance to loop them back in with a little bit more, I think, focus on like their industry, because I think there is, I think at the core of it, I think all of us here like agree that the retail portion of this is super, super important, and we want to move that along. So, I will just like point out that we can bring them back into the fold after having a discussion. So just throwing that out there. And at that, I think, do we have any more discussion about the amendment to remove? All right. Can we take a roll call vote?
I'm trying to talk.
Oh, sorry.
Well, I'm prepared to withdraw my motion and instead move that we hold this, because first of all, I think this committee has been listening extensively to all this input from our long-term care. I don't quite know what term to use. And so I think we as this committee should come to grips with what we want to recommend that council consider. So I think we're not ready to vote. I don't feel that we're ready to send the ordinance to council without making a decision about the long-term care industry. And if we could hold it for a month, I'd look to Mr. Vick for how long, to give our child care community a chance to look at the ordinance and give us their comments. So then when it comes back to us, let's say in a month or more, we would have the benefit of the input from the child care community and be able to digest all the information we've heard this evening. So I move to withdraw my motion to amend the ordinance, and I move that we table this ordinance to, was a month enough, to our June meeting.
We also have Mayor Biss here.
Well, first, was there a second to that motion? Oh, I'm sorry. Well, she made, Councilmember Revelle also withdrew the motion and made another motion, which was to table.
Yeah, I will second that.
Discussion about the motion to table. Mayor Biss.
Thank you, Chair Hadakatis and members of the committee. Obviously, I don't serve on this committee. I certainly don't want to insert myself inappropriately. I respect whatever decision you all come to. If you're comfortable, I'd appreciate a chance to just respectfully share some thoughts. We were here 2 months ago to discuss this at the time of introduction. I spoke at this podium about how important the underlying issue was, but how complicated it was, and how important I thought it was to get a lot of input. And I want to, first of all, thank a lot of stakeholders in the community, many represented in the room tonight, and many not, who shared a ton of really helpful, constructive input during the course of the last 2 months as we've tried to work through some of the tougher issues and strike an appropriate balance. I think that's really what needs to be sought here, is a balance between the different legitimate and important considerations. What's emerged in the last half hour is that the committee understandably doesn't feel ready to definitively weigh in on that as regards all the industries. And I understand why that is. I get that those are tough questions. But I do want to echo the point that that Chair Hadakatis made, which is that the underlying issue is an important one, that the retail subject matter is really kind of core to what this is about. I think, quite frankly, there are stakeholders in the community who've been nervous for a couple months, wanted to see what direction folks were going to head. And I don't know that an additional lengthy period of delay improves the situation. So with obviously respect for whatever y'all decide to do, I would ask you to consider taking out the subjects that there's still no resolution on, taking out the nursing homes, taking out the child care, allowing for further discussion, and voting what's left out to council. If that discussion over the course of the next couple council meetings, during which time this would have its first and second reading, gets to a point where y'all are ready to add something back into the council level, great. If it doesn't, then pass what you're comfortable with at the council level, and then come back later and have further discussions. But my own view is that drawing out the part that there is agreement on doesn't really help either the underlying cause of helping workers or kind of build the kind of harmony in the community around the areas where I do think we've made real progress toward that balance point. And so that would be my request of the committee.
Thank you. We have Councilmember Reed.
Yes, I would ask Councilmember Revelle maybe if she'll withdraw her motion that you just made now and reinstate the initial motion. Otherwise, I will make the motion to remove the nursing homes and the child care because, as Mayor Biss always very eloquently says, it is important to move forward with this, with the things that there's complete agreement on. And Councilmember Chair Hadakatis mentioned that, we can revisit this. We can come back with a trailer bill to look at the intricacies of the child care industry and nursing homes. But what there is what is crystal clear is the retail component. And so I would urge us to move forward with that.
So I withdraw my motion to table.
Great. Do we have...
And then can I make a new motion?
A new motion.
A new motion to forward this ordinance to City Council after removing the portion that addresses the long-term care industry and the child care community.
Second.
A point of order, the motion would be to remove long-term care and...
Right,
yeah,
however,
okay.
right.
So the amendment on the floor is to amend the ordinance and remove child care and nursing homes, long-term care. Yes. And so we have a second. There's no discussion, I don't think, and then we can take a roll call on the amendment.
Councilmember Burns?
I guess I did have a question, but if discussion is over, no.
Councilmember Ravel?
Aye.
Councilmember Reed?
No.
Councilmember Harris? Aye. Councilmember Harris.
Aye. So the amendment passes. So the ordinance as it stands now has the removal of childcare and nursing / long-term care facilities. Now if we can have a vote on the amendment as it stands. Roll call, please.
Councilmember Burns?
No.
Councilmember Ravel?
Aye.
Councilmember Reed?
Aye.
Councilmember Harris? Aye. Councilmember Harris.
Aye. So the motion passes, and we'll move on to City Council. That brings us to...
And Chair, I'd like to make a motion, if I may.
Sure. Councilmember Burns.
Make sure that the question of on whether or not to include the long-term care community as well as the child care community does in fact come back to a future Human Services Committee meeting. I don't believe simply by removing it from the ordinance that we just passed requires it to come back. So I would like to make that motion.
Second.
Okay, and just to clarify, this would be that we would, at a later date, come back to address the nursing and long-term care.
Correct. Yeah, because that was my well, yes, we can make I can speak more to it during discussion, but yes.
Okay. Thank you. And looks like you have your hand raised for discussion. You're first.
Yeah, I was just going to clarify again what Mayor Biss said, and I think the thought behind what we could do is to explore this in the future. But again, just by amending something, that doesn't require what is then excluded to come back. And so that was my question, which is why I said I have a question, but if discussion is over, I'll just vote on it, vote no. But now that that's done, I'd like to, that's what this motion is about, is going through the proper kind of legislative procedure to make sure it does in fact come back for more discussion and consideration. That's all, Chair. Thank you.
Sure. As you bring this up, personally, I'm thinking, obviously, a month from now is not, at least to me, I'm thinking this should be revisited at like 6 months or 8, because I don't think that the staffing and recovery from the pandemic issues and the hiring and staffing will change that much in a month. What was the time frame that you were thinking?
Well, again, Mayor Biss, correct me if I'm wrong, but what Mayor Biss described, it seemed like there would be some time to continue to discuss this as the item that we just passed would be discussed. And so if there was any agreement, we could amend before that passed if there was any agreement on what to move forward with it. What you just described is very different than what I understood everyone, or at least Mayor Biss presented. Mayor Biss, I'm sure you're still in the room, correct me if I'm wrong, but waiting 8 months, the other item will be passed prior to 8 months. So in line with what I think I heard Mayor Biss describe, I would like to see this move along at a similar pace to what the other item, to keep up with the other item. So if, again, we choose to make any changes and amendments, that there's an opportunity to. Obviously, it doesn't require us to, make any amendments. We may decide that the choice to exclude those facilities from the ordinance was the right one, but at least it gives us an opportunity to incorporate anything that we learn.
Okay, Mayor Biss, if you want to clarify.
I'm happy to. Just as a point of information, certainly, Councilmember Burns, with what we just voted forward, that is its own thing. We all have the opportunity to make any amendments during the next, 2 readings or potentially more if it's held. But I agree with the approach that Councilmember Hedekadis just mentioned, which is allowing this ordinance to move forward as we just voted it out of committee, and then taking the necessary time, which could be 8 months, a year, however long, to really dig deep into the concerns of the child care and nursing industry, and also to allow time for us to get further out of COVID, so less and less that becomes a valid point in their favor. So I will, with that in mind, I support the idea that you're saying, but I will withdraw my second to your motion.
Okay, so
Now
we are at, so we've had Councilmember Burns' motion to make an amendment to bring this specific issue back, and we're waiting a second.
And 8 months is fine. What I'm saying is if we're not going to bring it back, then let's just say that. But if we want to bring it back, let's bring it back when we want to bring it back. I was simply adding my opinion on what I thought Mayor Biss was referring to. But
I'm happy to support bringing this back.
If we
in 8
want it to
months.
be 8 months, that's fine. But if we don't want to do it at all, let's just say that. What we just did, though, is act like we wanted to continue considering it. And so let's at least do something so that we can actually live up to what it sounds like we said we wanted to do.
So I second your motion to bring this back in 8 months, particularly the portion regarding child care and long-term care facilities.
Great.
If
Mr. Vick?
I just want to say I could commit to bringing this to the Early Childhood Council within whatever designated time you say, and we could review it and give feedback as to your discretion of that time period. It wouldn't take us 8 months to do that, but if you needed whatever time you need, we can commit to looking at this ordinance and getting enough people from the early childhood community to give you a valid response and our thoughts and opinions to help your deliberation. So I commit to do that with the council at your discretion.
Great.
Mr. Vick, Chair, if I may, that's why I hesitated at 8 months. I think that is a considerable amount of time. I know it wouldn't take that long. If there's only support for 8 months, so be it. I just don't think it's that much time is required, but I'm happy to support whatever the will of this body is.
So I think I can, I'll share my thoughts. Like, I think that the discussion would not take 8 months, but I think the state of like the workforce and the world in general might be a lot different in 8 months. It's not going to be that much different in a month. I don't know the right answer exactly. I mean, I think I'm committed to hearing this again for those specific industries, whether it's 8 months or 6 months. I mean, we can do 6 months. That sounds like that way we're not kicking the can down the road too far. Would you take a friendly amendment to be 6 months?
Sure.
Sure. Okay, so I think procedurally, Ms. White, I'm sorry for all the changes here.
Well, this is an entirely separate motion.
Yeah, so this is the motion to revisit the child care and nursing care industries in 6 months. So.
Okay, Councilmember Burns.
Aye.
Councilmember Ravel.
Aye.
Councilmember Reed.
Aye.
Councilmember Harris.
Aye.
Councilmember Harris.
Aye. And that motion passes, so we will be back at it in 6 months. So let's move on to our next item. Can I have a motion for HS1, please?
I will move item HS1, Rat Control Progress Report, to accept and place the report on file.
Second.
All right, we have a second. All right.
Hello. Good evening, members of the council. Do we have the presentation up? Anderson said it was on the. Yeah, there it is.
As long as we're not showing rats, we're showing rats, I don't want to see it.
I thought about including pictures, but no pictures tonight.
When they started talking, I was scratching.
All right, well, good evening, members of the council. My name is Greg Olson. I'm the Public Health Manager for the Health and Human Services Department. And tonight I'm here just to provide a few updates for the city's rat control program. So just a brief history of how this program was conducted. In prior years, the responsibility for the program was split between HHS staff and a contracted pest control operator. The HHS staff handled the administrative in-house of all the complaints, and then the contractor handled the inspecting and the placing of bait boxes out in the field. And this started out very well, except over the years we've seen a decline in the program efficiency, effectiveness, and overall communication between city staff, the contractors, as well as field staff and residents themselves. And there's included is a small graph showing, so the blue line is the number of rat requests that we've gotten 311 going from 2015 to 2021. And the red line is the average length of time each case remains open. And so ideally, you would see those two lines go in parallel with one another. As our number of requests decrease, we would also see the number of days cases open also decrease. However, we're seeing the complete opposite, the crisscross. So with that in mind, we decided to move the program in-house, and we hired 2 additional staff who are out in the field 5 days a week. They are there communicating and educating residents, as well as providing inspection services and baiting properties. And since they've been employed by the city, which was towards that later half of 2022, we've seen already an improvement in communication and the effectiveness of our program. And this is from October 2022 to March of this year. And you can see that's pretty much what we want it to look like. We have the less requests we have, the less days they're spent open, because we have more time to focus on each individual request. And so some of our program strategies, even though it's first on the list, this isn't our first option. We do have different ways we're tackling rodenticides. We swap up the bait variety. So we'll use, there's different formulations, whether it's a hard block, whether it's a paste. Rats are very intelligent mammals, and they have a palate as well. So we kind of got to change it up a little bit. And then we're also toying with the idea of using CO2 for rat burrows. And this is a more environmentally friendly, humane approach. Essentially, CO2 is injected into rat burrows underground, and the rats don't notice the gas coming in, so they don't leave the burrows and flee. Essentially, they go to sleep. And it's a more humane approach, and we're currently looking into investigating if we can use it here in the field. But our main priority is education. You can have the best bait boxes, you can have the best rodenticide, but if properties aren't being maintained well, rats will still flourish. So our inspectors in the field are heavily relying on communicating with residents. So we make appointments with residents to meet them in the field to discuss the specifics about their property, because a lot of times residents are inadvertently bringing rats into their property. It could be a compost bin that's improperly maintained. It can be pieces of lumber or a garage door that doesn't close all the way. All these things can lead to a bigger infestation of rats. And then another thing that we're going to be doing this year is called our rat walks, where we look at the heat maps that we have of the city where we're getting the most requests, and we send our inspectors to that area to essentially go door to door to the neighbors and educate about the specific contributing factors that are on their properties. And we've in the past have coordinated this with the alderman and council member of that area so they can come out and walk with us. I know Alderman Rainey was always willing to come out on a walk with us, and then also announce it at ward meetings so residents can come out with us too. And it's actually, if it's a sunny day, it's actually pretty fun. So we're looking to start that again. And then another thing we're looking to start again is we call it the Rat Academy. And this is just another opportunity for residents to ask their questions, to get clarification, and to also give us questions, give us suggestions, and also point us in certain areas of their neighborhood that we should focus on. And lastly is enforcement. Since we're in public health, we're not in the business of making money. We don't want to fine residents. We don't want to issue tickets. That's the last thing we want to do. Our goal is to educate, to gain an understanding of what the requirements are, so that there is compliance. But sometimes, education doesn't work and we have to rely on our codes that we have. And there's about 18 different code violation, ordinance violations that pertain specifically to rats on the property. So if it comes to that, we do have that enforcement piece in our back pocket, essentially. And education is important mainly because, so this picture is just a standard city block, and in the upper left corner you can see a little red dot, and that represents just one rat burrow. And the typical range of a Norway rat is about 100 to 200 feet. So that one burrow affects all the surrounding areas. That's about 20 different houses. So it really does take a community effort. So with that in mind, we always encourage residents to call 311. And it's not just calling 311 about, I saw a rat scurry down an alley. It's calling 311 to let us know that, you've seen overflowing garbage, whether it's at a restaurant or a residence, multi-unit building, whatever it is. Let us know about that, and we'll work with the property owners. And don't think, whenever I'm on a ward meeting call or talking with residents, don't try and think of it as, you're telling on your neighbors, because essentially you're doing everyone a service by not having the contributing factors in the neighborhood. And also, if any residents have questions, we can always be reached at our email address, which is health@cityofevanston.org. We have multiple eyes on that email inbox, so if anyone does send something in, they should get a pretty speedy response. And then lastly, I don't think the heat maps were included on the memo, so I just wanted to add these here. So this was 2021. Obviously, the darker red is the more requests that we've gotten. And as you can see, it's pretty much all over the city. It's in every ward. There's a lot more requests down in the southern part of the city. We kind of see the same pattern as last year. It's a little bit lighter of requests, and then this one is this year, January to present. And again, it sort of follows that same sort of pattern, but a lot of our requests are in the business district and then also in the south portion of Evanston. So the only thing I would recommend is, at your ward meetings when you're talking with residents, to encourage them to contact 311 and let us know, and that we're here to help and work with you guys.
Great. Thank you. Councilmember Harris.
Thank you. So first of all, I'm going to be in trouble with my mother because my face was frowned up the whole time of this conversation. But thank you for this information. Someone mentioned the feral cats, and I'm just wondering. I don't like cats as much as I don't like rats, but if it works.
Yes, that's been a topic that it comes up every year. On a small scale, it can be effective. However, when looking at, the city as a whole, it wouldn't be effective to have feral cats as our main option. I know there is a property in Evanston that does have feral cats, but it's a small property, so it can be effective, but I'm not entirely sure of, how long it can last or what scale they can protect, essentially.
I'll just weigh in on the feral cats. In my neighborhood, we have a handful of people who have cats that they let out, and I have not seen, knock on wood, a rat around my house. But cats, as much as I love them, are little murderers. Like, they wreak havoc on wildlife. I saw Councilmember Revelle when the suggestion came. So I think for a bird, as a bird city, that might be a bad idea.
Yes, okay. So, yes.
Councilmember Reed.
That was going to be my very point there, is that feral cats are lethal to many critters in our community. I appreciate the work on this, Greg. I think I've certainly had folks I had Director Ogbo come to a ward meeting twice to talk about rats over the last 2 years. About once a year at least we need to have folks come out because it is a huge issue. And South Evanston is certainly shaded on that map quite a bit, much more so than North Evanston. So this is a huge issue for me and my residents. I personally think that one of the greatest things we can do to curtail the rat issue is to cut off their supply to food. And the way we do that is not just by poisoning them and, all of those other things. I would really like us to explore changing the way that we collect trash, because that's what they're eating. They're getting into our trash bins, they're climbing up fences, they're climbing up bins, and I would suspect that, aside from, dog waste that's left outside, is certainly a main source of sustenance for our rat population. And there are many models, I think it was Greg or maybe it was someone else that I spoke to regarding looking at alternative models such as, even in rural parts of Wisconsin, folks, you don't have a trash bin behind everyone's house. In Norway and other, Nordic countries, that's also the model where instead of having a bin behind everyone's house, which I think is, if we really think about it, we bring all of this trash into our house. Why do we then expect a city worker to come and personally collect all of the trash that we willingly brought into our house? In other countries, there are centralized there's centralized trash collection locations, in every neighborhood, very easy to access. These things are built in and they're underground. So, I think, it keeps the rats and rodents and other vector away from the trash. And, I'd love to look into, how that's, what the impact that's had on the rat population. I haven't studied that exactly, but I would imagine that has a huge impact on the rat population. In New York, in fact, under Mayor Adams is, with their new rat czar, they are looking at changing the way they collect trash. I mean, their model is a lot worse than ours, just throwing it on the sidewalks in front of, buildings, which certainly gives the rats access. But I think they're looking more toward that, model that is exists within rural parts of our country, within many other urbanized countries, first world countries. And, we can rethink the way we collect trash, make it more efficient for city government. There's potentially even health benefits to having people, not just go to their backyard and throw it away, to walk a block to throw away their trash. And so I think that would have maybe the largest impact on our rat population if we could figure out how to keep them away from trash. So thank you.
Thank you.
Great. Don't see any more comments, so thank you so much for the report. We'll probably be asking you to have a rat walk in the 9th Ward soon. Great. Moving along, we have, can someone please, can we have a roll call vote to place the report on file?
Councilmember Burns.
Aye.
Councilmember Ravel. Aye. Councilmember Reed.
Aye.
Councilmember Harris.
Aye.
Councilmember Harris.
Aye. With that passes and is placed on file, can we have a motion to move HS2?
I will move item HS2, proposed modification to City Code 958 in regard to gambling.
Do we have a second?
Second.
Great. And now the floor is open for discussion. Councilmember Reed.
Yes. This was a part of a package of ordinances that I put forward a while ago, dealing with our criminal code with potential concerns around over-enforcement. I shouldn't say over-enforcement, with potential misenforcement, and not on the part of our officers, but on the part of the council for putting this on them to enforce some of these provisions, and making sure that our city code aligns with the world as it is today and with our values as they are today. And, you know, I look at our police department having to enforce gambling, you know, in the way that the ordinance is currently drafted, especially as is potentially putting our city at liability, legal liability, and missing an opportunity for potential to make sure that we're not over-policing certain communities. Folks in public comment have raised that, you know, on the flip side of that, which, you know, my concern was the criminal justice aspect. On the flip side, there is an opportunity for revenue to be generated within the city. And I believe, Chair, you received a letter, as well as I, from an organization that is in support of the proper regulation of gambling, and they noted again that this is, and as well as Mr. Beatty and other public comment, this is potentially a good source of revenue for the city. You know, our dollars are potentially leaving Evanston, or certainly leaving Evanston, because we don't have this, and we could keep more of that money local. This could benefit our small businesses who choose to install these, you know, potential gaming machines within their establishment, and be a source of revenue both for the city, again, through sales tax and the gambling tax, as well as a source of revenue for those businesses. And, you know, we've had a lot of folks express concern about supporting our small businesses, particularly as we come out of COVID. Last thing I want to say on this is, again, like other things I've put forward, gambling is legal here in Illinois. You're allowed to gamble under state law. Certainly is regulated under state law, and I think we need to more closely mirror state law on this issue. You know, our code was, as it stands today, I argue, whether you are supportive of gambling or you think it's the greatest moral injustice someone could, you know, commit, our code as it's written today is not helpful. You know, our code was written in the 1950s and did not imagine a world where cell phones existed. And as the code is written today, if I were to download, and I have not, and I don't have it, so don't come after me, but if I were to download DraftKings or any of those other, you know, gambling apps that are allowed by state law onto my phone, as it is written, the Evanston Police Department would be able to confiscate my phone and place me under arrest, simply for having DraftKings or one of the other, you know, now legal gambling apps on my phone. And I'm seeing a few faces out there that are indicating confusion. I will yield my time, and in that meantime, I'm happy to pull up the section of code that specifically addresses this, so we're all on the same page. Thank you.
All right. Thank you, Councilmember Reed. Personally, I'll weigh in. I think, I've spoken with a number of residents who are in favor of kind of, loosening our code around gambling, specifically for small businesses. And, this is like a first step, so I'm in support. Goes back to Councilmember Revelle.
So towards the end of the pretty brief memo on this, it says that EPD does not recommend modifying the code to make a distinction between gambling on private and public property. I'm just interested in more information about what the issue is there, and basically how often are we actually enforcing the gambling ordinance?
Chairman, members of the committee. So how often are we enforcing the gambling ordinance? We have not had a gambling arrest in the last approximately 10 years. I think we checked back that far. Enforcement of the gambling ordinance is historically something that's a couple generations ago, but not a recent problem. It's my understanding with the language that you pointed out at the end, and I'm going to try to kind of summarize, I think, the goal of that language. If I'm a little off or I'm proven to be a little off or misinterpreted later, I apologize. But I think it's the position of the PD that any language that would result in privatized gambling that was outside of regulation or oversight would be something the department would be concerned about. So I think that that's what that language is trying, or that paragraph is trying to point out is, I think we're standing relatively silent on a lot of what's here, taking the lead from the legal department and other regulatory agencies. However, language changes that are going to let gambling potentially evolve and grow without regulation or the appropriate amount of oversight is what the concern for the department is, because that could lead to quality of life issues in certain areas, other crimes, or so on and so forth. So, like I said, that's my understanding of the goal of that language.
Okay, thank you.
Well, and I guess, I don't know if this is necessarily a question for you. So I did look at the ordinance. It's quite lengthy.
It is very lengthy, yes.
And there was one specific section, I guess, that addressed video gaming. So if the goal here is to pave the way for video gaming, couldn't we merely focus on that piece of the ordinance? I guess I'm reluctant to have to ask staff to spend a lot of time trying to rework what is a pretty lengthy, detailed ordinance.
I'm happy to respond to that. With gambling, as it's written, gambling being illegal in the city, you couldn't allow, these devices and say, So I think Commander Glue's perspective there, I'm fully on board with it. I think that, we need to make sure that gambling establishments are regulated. I don't think it makes sense to, willy-nilly allow willy or nilly to create a gambling establishment in their home. And so there needs to be strict regulation about where this can and cannot take place. But also, generally, if we're going to allow folks to go to a restaurant and gamble, I think the way this is written, again, 9583, gambling devices. Bringing a gambling device into the city, any person who brings into the city or has in his or her possession in the city for the purposes of gambling any table, thing, or device of any kind or nature whereon or with which money or any other thing of value may in any manner be played for, shall be fined not less than $200 and not more than $500 for each offense. Again, the way this is written would leave open, what couldn't have been contemplated in 1957, cell phones and other devices, including these legal machines, that we would potentially want to see in our city. And again, also for folks who particularly, I think it's culturally relevant within around Thanksgiving for particularly maybe the Black community. It's quite often that there's like the games of spades and whatnot that happen at Thanksgiving or Christmas, and sometimes maybe quarters are bet, or maybe nothing's bet, but it quite often happens, as a cultural pastime, particularly in certain communities, and I don't think that we should have in our code something that criminalizes something potentially as innocent as that. I think what we need to make sure is that we're giving our police department all the tools they need to, if a disturbance of the peace occurs, to enforce that. But allow adults to be adults and step back from, this moral policing that we've often fallen victim to.
I just want to make something clear. I don't see, and I don't think necessarily, I think you're bringing up where the spirit, how the ordinance to be applied now is not in step with the letter that was written in the past. But I don't see a scenario where the police department would seek to enforce video gaming on personal communication devices. Also going with the talking about the purpose of an ordinance sometimes is elimination of a behavior versus acceptable compliance. So when you talk about sometimes people engaging in low-level gambling amongst friends versus the evolution of some private gambling house or so on and so forth. So there's the elimination, and then there's acceptable compliance.
Yeah, thank you for that. And just to close here, I just want to make sure that our code gives the police department all the tools that you need to do exactly what you just said without going further. Because, while I wouldn't expect if I did have DraftKings that you would arrest me or give me any ticket, we have found that sometimes with what's very concerning is when we have a piece of code that has not been enforced for over 10 years. We know that to be true with a number of other places in the code, such as the ordinance that we eliminated, which was the obedient, or we either eliminated or made some really stiff changes to it, obedience to police in a public place. We saw that was a piece of code that was not enforced very often, but when it was, in the limited instances where it was, Lawrence Crosby was arrested for it, and that led to a $1.3 million lawsuit here in the city. I was arrested when I was petitioning for this piece of code, and that was an unlawful arrest that could have led to a potential suit and costing taxpayers money. So I think it's important to make sure that when we have sections of code that are not being enforced, that we take a strong look at it and make sure, is it not being enforced because officers deem it outside of their core duties. And I'll leave us with this. All too often, I hear a say that we are asking our police department to do too much. We are asking them to do things that are out of the scope of what we really want them to focus on. Well, what are those things? What are those things that we think we're forcing onto them? And I think this ordinance, as it is written, is one of those. And so, again, whether you agree with gambling or not, I actually am someone who is staunchly opposed to gambling. I have some friends who are addicted to it. I don't like it personally, but I don't think they need to be arrested for it. I don't think they need a criminal intervention, and I don't think our code even needs to have that within it because it puts us at liability. It's forcing work onto a police department that shouldn't even be something that they would even have to think about enforcing. And we can write this ordinance in a much more tailored way that allows for the regulation of gaming establishments, prohibits, again, willy or nilly or whoever from turning their home into a gambling establishment, and ensures that normal behavior can occur. Thank you.
Okay, seeing no further comments, I think we can take a vote on this. Oh, is this? This is.
There was not an ordinance before us. It is listed for action, but there is no ordinance in the packet as I see. So What I would do is I will move, Ms. Lepsinger.
This is listed for action because we would like the committee to vote on whether or not you'd like staff to move forward with this as a concept.
Yeah.
If this is going to be dead on arrival, then we're not going to spend our time on it. So we would like you to take a vote this evening. Same with the next item. Thank you.
Yes. So I will move that, given the feedback that we both received from public comment and what I think I'm hearing from my colleagues is that we are interested in reviewing this ordinance, particularly to allow for the regulation of gaming establishments. And we'd like to see that brought back. I don't know if that requires a zoning amendment as well, but I think, we can look into all of the requirements that would need to change here. But I think the first step along with that is, adjusting what we see as criminal and what we don't see as criminal. I think, certainly, again, someone running an illegal gambling establishment is something that we still want to prohibit and regulate. But, low-level familial or, non-disruptive activity, such as going into an establishment, Thanksgiving or Christmas or whatever, game, those things should not be regulated. So I think that's generally what I'm hearing that we'd like to see come back. So I move that, I don't know how much time, is this 2 months, 3 months, or, a month that we want to allow for staff?
I think
three months is what I'm seeing. So if we can bring this back, what month are we in now? May 1st. All right.
There needs to be a vote.
I know that. I'm making the motion to bring it back in 3 months. So I move that we bring this back as an ordinance in 3 months, given the feedback that we've heard from this committee.
Do we have a second? I'm the chair. I guess. Okay. So, all right. So we have a second. So we are voting to commit staff time and bring this back in 3 months. Can I have a vote? Roll call vote, please.
Councilmember Ravel?
No.
Councilmember Reed?
Aye.
Councilmember Harris? Councilmember Herrick Harris?
Aye.
Councilmember Burns? Councilmember Burns?
Oh, sorry, thought I was unmuted. Aye. Sorry about that.
Okay, so the direction for staff is to come back in 3 months. I've had a request from staff to skip ahead a little bit. Can someone please move forward to HS7?
I move item HS7, ordinance 1023, amending the city code and creating section 3222, retail single-use bag tax and ban.
Do you have a second? Great. The floor is open for discussion. Councilmember Reed.
Thank you. This ordinance, just like the Fair Work Week ordinance, has been before us a number of times. Folks are familiar with it. We've made a number of amendments to take into account some of the comments that we have heard. There is a gift bag exemption, which exempts gift bags. And so I think we're at a place where we should move forward with this. This aligns with our CARP goals. Particularly a bag ban and tax is the most effective measure we've seen to curtail this. I'll note, just anecdotally, but my personal experience, I was in Mexico recently, and the city that I was in banned. They're near the ocean, and they banned plastic bags completely. And I was not aware of it when I went to the store. I didn't bring my knapsacks with me all the way to Mexico, so I wasn't planning on shopping at all. But got there, and the cost for a single bag was $1.50, not 10 cents, not 15 cents, not 7 cents, not 50 cents, $1.50. And I can tell you, they had some of the cleanest streets I've seen. I was actually quite embarrassed when I came back home and walked around and saw all the trash strewn around, particularly plastic bags. They make up a lot of the trash that you see, particularly, just like you see that rat map that we had up earlier, particularly in my ward in the South End. We see this a lot, and it's, you know, some of it is it's coming from all over, and you know, I think this ban, this bag ban and tax is critical to our environment, critical to making our city more inviting, to making it a cleaner community. And I would encourage us to get as many of these bags out of our community as possible. And that doesn't even layer on the comment that we've heard from folks regarding the health impacts of microplastics and, you know, the nascent research there about the potentially harmful impacts of these microplastics, you know, both particularly on the human body. And so I would encourage us to move forward with this as presented. And also I intend, because this is in alignment with our CARP goals, and I don't think we need to go through this process a second time, I plan to amend this to also include single-use plastics such as, you know, single-use utensils, styrofoam, and those other materials. We've heard from the business community that that is something, at least the folks who came out and were against this, they were certainly supportive of moving forward with a ban on other single-use plastics. And I think, you know, again, with our CARB goal saying that we'd want to hit that mark by 2025, if we add that in here and we put that in alignment with the actual bag ban, which is 2024, we can meet that CARB goal a year ahead and really turn this ordinance, you know, supercharge it to make sure we're getting more and more of these harmful plastics out of our community. Thank you.
Councilmember Burns, I'm paying attention to the Zoom, so you're up next.
Thank you. Thank you, sir. I would imagine Kara Pratt is with us.
Yes.
Yes.
I had a quick question. So, in the way it's written currently, or maybe the way it's always been written, would this exempt, you know, delivery bags specifically through the delivery services like the DoorDash, et cetera? Are there any exemptions for those types of for bags provided through those deliveries?
Thank you, Councilmember Burns. Kara Pratt, Sustainability and Resilience Manager. Good evening, members of Human Services. There are two versions of the ordinance before you. The original version does not have exemptions for restaurants.
A point of information. My understanding was for delivery, there was that delivery bags were not included in the ordinance.
That is incorrect. In the alternative version, restaurants are exempted from the ordinance. I can read through the exemptions from the original version versus the alternative version, if that's helpful.
I think that would be helpful. Yes,
okay.
Thank you.
So as a reminder, the original version, as Councilmember Reed mentioned, exempts gift bags. This was the first iteration of this ordinance, and the alternative version came as a result of the straw poll that City Council conducted earlier this year. So the original version, the scope of the bag tax or fee would be community-wide. The exemptions related to people are just SNAP recipients. The exemptions related to bag types are gift bags, bags containing prescription drugs, newspaper bags, and pre-checkout or produce bags. Compared to the alternative version, so we have the scope difference community-wide versus just retailers over 10,000 square feet. The exemption difference, original version, just SNAP recipients versus SNAP recipients, restaurants, non-chain store organizations, and retailers under 10,000 square feet. Exemptions for the bag types, Original version, as I mentioned before, gift bags, prescription drugs, newspaper bags, produce bags. Alternative version does not include a gift bag exemption because it's just retailers over 10,000 square feet. So that's only prescription drugs, newspaper bags, pre-checkout bags, or produce bags. There is also an error in this table that was submitted. The fee amounts are reversed. So the original version is a 15-cent tax and the alternative version is a 10-cent tax.
Thank you. Again, going off video because I think my connection is a little shaky. So I plan to make an amendment adding back restaurants
Point of order. What's before us does not take out restaurant.
Are you sure?
The version that I moved for us to was the version that this committee voted on and not the alternative version. The version I moved was the original version.
Okay. Right. Well, what I'll say is I no matter where this ends up, I will be opposed to any version of this that does not include a community-wide plastic bag ban, whether it be for businesses under 10,000 square feet or not, or restaurants or not. I have paid close attention to the discussion around this issue, and as I have stated before, I have not heard one single concern about the plastic bag ban. And so we have, by removing that in the version in our packet, at least one of the versions in our packet, we have, without question, went further than the community has even asked us to go. And I will not support that. And I just want to make that clear. So I understand now what has been moved, and I will rest from the floor. Thank you, Chair.
Thank you. Councilmember Ravel.
Well, I strongly prefer the alternative version, and I don't know what more to say than that. I mean, I think starting with our larger retailers of 10,000 square feet or more is an important way to go. We heard loud and clear from our smaller retailers when we were looking at the original version that this was really going to be a hardship for them. And that's why we had to have the gift bag concept. The alternative version immediately, August 2023, bans the single-use point-of-sale plastic bags at the larger stores, and that's, I think, where the real problem those are the most offensive plastic bags in our community. So I would. I think that's where we should start, and it's exciting that our grocery stores apparently are prepared to provide compostable produce bags. So it will make a huge improvement, I think, in our community to ban those single-use plastic bags from the larger stores, and to mean that every time any of us went to a grocery store and we wanted to put our lettuce in a produce bag, it would be compostable. And if we forget our reusable bags and when we check out and we need a bag, it would have to be a paper bag that's made of post-consumer recycled content. Anyway, I strongly urge us to work to approve the alternative version.
Thank you. Councilmember Reed.
Yes, I will, double down on what Councilmember Burns said. One, I am fully in support of the original version. It's when I walk through my community, I see plastic bags. I don't know if it's from a big retailer or a small one. Maybe if it has the Jewel Osco sign on the side of it. But these are, a plastic bag in the community is a plastic bag in the community that is harmful, whether it's coming from a big retailer or a small retailer. I don't think I don't think this logic would apply to to many other cases that it's okay if a small business is polluting our environment, but it's not okay if a large business is. It's not okay for anyone to do it. And we need to change behavior. And many communities, many even states, have adopted this kind of ban. And in fact, in some of them have gone further than this, particularly in other countries, because they are taking this serious. This is we know that in order to, again, if we are going to say that CARP is one of our priorities, that our climate action resiliency is one of our priorities, and if we truly believe that this is, a crisis that we are facing, we are going to have to start to take steps that make people feel a bit uncomfortable, that change behaviors. Again, the way folks, and particularly, my colleagues up here, talk about climate change, this is an existential crisis. There won't be a small business, if we don't get this right. And so we need to start really taking this serious, setting the tone not only for Evanston, but for the state and for our neighboring communities. And I think it is extremely imperative that we move forward with the original version, or, because I'm certainly counting votes and reading faces up here. If folks are so inclined to go with the alternative version, which I think would be a mistake, we need to amend it to ensure that the ban takes place, the ban and tax take place for everyone, every retailer, beginning with the, in 2024. Maybe we can push it back a year. I do see that the start date for the alternative is moved up a bit, but I think, we can push that out for the smaller retailers to have time to make the adjustment. And I will note, I think it's really important that we do this, we move forward now, particularly with the original version, because, again, we're going to need our small businesses to get on board, too. And currently, we have funds within our climate action fund to support small businesses. Kara, can you maybe talk about the funds that we have for small, that would be available to small businesses who need assistance making the shift?
Sure. On Earth Day, we launched a new iteration of Sustain Evanston. These are grants up to $25,000 for general energy efficiency, decarbonization, and waste-related projects for small businesses, and it would include transitioning the types of takeout containers as well as other waste management activities.
Thank you. And so, with that, I think it's important that we make this full change now. We allow our small businesses the opportunity to have access to these funds to make the adjustment. And I'll note that 5 cents of every of every portion of the tax, or every 15-cent tax, goes to the small business to help cover the cost of both the bags and implementation of this. And it's, as I demonstrated, it is not a burden, a huge burden to track the sale of these bags. And this 5 cents per bag will certainly help cover that. And I want to note that, with the alternative version that lowers the tax to 10 cents, we need the funding for education and for equity sense. If we're only giving 5 cents to the business and, I forget the exact breakdown, 2 cents to solid waste or 3 cents, and then vice versa for the health department, we are not having the adequate amount of funding to make sure that when we do ban plastic bags entirely, that the entire community knows how to use these reusable bags, or we're just going to have folks switch to, these, yes, they're recycled paper bags and, potentially bags made of other materials. But if they're not reusable bags, and we'll still have the problem with these ending up in our waste stream, or worse, not in our waste stream and in our community. And these, particularly paper bags, if I'm not mistaken, are they take more energy to produce than plastic bags. And the goal is to move people away from all of these single-use bags, and not just away from plastic bags, but from all single-use and to more sustainable sources. And so I would really urge us to keep the tax at 15 cents. And I'll close with this for now. There's clear research to show that a ban alone is not as effective as a ban plus a tax in changing behavior. I would really, that $1.50 in Mexico, certainly was a reminder that I don't think folks forget to bring their bags when you pay that once. And there don't seem to be many exemptions there. And so I would encourage us to be bold, to continue to really live up to our CARP goals. Thank you.
Okay, great. I'll just chime in and say that I'm in favor of the alternative version. I just think we need to have something that will realistically pass at City Council, and we need to just start on this, and that's where I'm at. Since we have two versions, we have a motion on the floor from Councilmember Reed to move forward the original version. Am I right? Or
correct.
So do we have a second to move the original version?
There was, Councilmember
Burns. Okay. So we will now, and this is this point of clarity for everyone here and watching at home, we are voting on the original version of the bag tax. We have just as a order of things, if folks are going to vote, like if you're Councilmember Ravel or Hedekadis, if you're planning to vote no on the original, I would encourage you to make the amendment. Okay, before we vote on it and then vote it down.
Could you clarify what you're asking?
I would encourage folks to make an amendment before we vote this down.
Well, I plan to just move. I plan to vote no with the hope that it fails, and then I will make a new motion to approve the alternative version.
I hear that. I think the proper order would be to move to move amendments to the original version to align with the alternative version.
No, I don't want to amend. I just want to. It's a completely different.
Can we hear from our counsel here? The legality. What's the right way for us to do this?
Since there are two proposed versions of the ordinance, it would be proper to vote on the one that was proposed and then make a motion to vote on the second version.
Okay. Thank you for that clarification. So I guess we will vote on the original version, and then we still have the option of voting on the alternative version if we have someone move the motion. So this, again, is for the original version of the bag tax. If we can take a roll.
And I have my hand up for discussion.
Oh, I'm sorry, Councilmember Burns.
It's all good. I just wanted to say I plan on voting for this to move it forward. I still have some concerns about it that I was ready to address at council. But if it does fail, I plan to make an amendment to the second version, and I will speak to that more at that time. Thank you.
Okay, thank you.
Just point of order. This is kind of silly. I'm looking at the faces here. Everyone's expressed to me where they are on it. The ultimate goal was this isn't a completely different ordinance. This is amending the ordinance. So I really would encourage.
I think, me personally, when I read the packet, I thought there would be a option to vote for one. If that doesn't pass, vote for the other. We've clarified with legal. I think it's written, I'm sure whatever comes out of this will be presented in its full form at City Council. So I think we should follow Council's advice. And so we are voting on the original bag tax amendment as written. Version 1.
Councilmember Reed?
Aye.
Councilmember Harris? Councilmember Harry Carres?
No.
Councilmember Burns?
No.
Is that a no?
That was no.
Councilmember Burns?
I said aye.
Councilmember Ravel?
No.
So the motion fails. Councilmember Ravel.
I move approval of the alternative version, that we recommend that for approval to council.
Do we have a second? I will second the alternative version. And Councilmember Burns has his hand.
Yeah, I would like to make an amendment to this version, if that is in order.
Sure.
I would like to amend this to reflect again what we have heard from our small businesses, those who are under 10,000 square feet, and as well as restaurants that I've talked to directly and that have addressed, I believe, this body, but also that we've talked to in small group conversations. And as I expressed before, I have not heard a single one of those businesses express concern about the ban. I've heard them express concerns about other areas of this, of the original version, but not the ban. And in fact, I've heard people very clearly say, just ban plastics. Don't move forward with other areas, that were previously discussed. And so, Councilmember Harris, I would appreciate some support on this, and I only call you out because I think everybody else is firmly in their position, and I only say it was a mistake that was made to include the ban. I don't know why it was included. It just got mixed up in all this somehow, but that has never been requested of us. And so I just ask for a little bit of faith in moving forward, amending this to include just the ban, to bring back the ban to include restaurants and businesses under 10,000 square feet. And I will pull the record, but between now and the council meeting, and I will show everyone here that there has never been a concern expressed about the ban. And so we should not eliminate it for restaurants and businesses under 10,000 square feet. In fact, again, they've encouraged us to do it because they see the importance of it. That's all, Chair.
Thank you. Councilmember Harris.
Thank you. And I'm glad you called me because I talked to Councilmember Ravel earlier, and I said I thought I remembered that we kind of paused and said we would just wait for the ban to play out. So I just wanted to say that I did have that conversation earlier, and I wasn't clear. So yes, I am in favor of what you suggested.
Councilmember Reed.
Well, what I was going to do is make another motion. I also am in support. So, Councilmember Burns, if you don't mind, I'll just and I'll also note this, and Councilmember Harris calling on you also with a similar effect as Councilmember Burns, since that worked. But I'm also calling on all of my colleagues, Councilmember Ravel and Hedek Cadiz, that would also very clear that we heard the businesses say. Many of them say that they support banning other plastics, such as styrofoam packaging and various clamshell packaging, and that aligns with our CARB goals. And with our CARB goals for 2025, let's get it done a year early. And so I would like to actually make the motion to both reinstate the ban for all businesses 10,000 square feet and above and under for plastic bags. I would also move that we ban single-use plastics such as straws and styrofoam and those other materials as well, in alignment with the in effect date for this ordinance.
Sure.
That's my motion.
Okay. And so, Councilmember Reed, if you can send that in an email form.
Could you make that into two different motions?
Exactly. That's what I would like to see as well.
Okay. So just to clarify, we'll wait for an email. If you could email myself and Director Stonebeck.
Happy to do that. Just point of information or order, that in writing amendment rule does not apply at committees. It only applies at council, just as a note. And what I'd really like to see is, between now and council, our law department and, our experts in the sustainability department come up with a clear definition for all of those single-use plastics that is, really in alignment with our CARP goals. And so that's what I'd like to see between now and council. I get at council when it's coming up for nearly final vote and we're making final action. We want it in writing, but that's why we have committees.
Councilmember Revelle.
Well, I would certainly be happy to consider part of what you're recommending, banning single-use, if I understand you correctly, banning single-use point-of-sale plastic bags for all retailers of any size, because I agree with Councilmember Burns that our smaller retailers are quite happy to not issue single-use point-of-sale plastic bags. When we start now talking about something we haven't talked about yet, I worry that we're going to get bogged down. So I would rather have you make two different motions and then, deal with the plastic silverware and the, all that other stuff separately, because is our restaurant community ready for that? I don't know. So that would be my request, that you make two different motions.
Thank you. Councilmember Harris.
Yes, while I understand it's just for council, I got really confused when you started saying all of that. So if we either put it in writing so that we're clear and our constituents are clear, or restate what you are expecting.
And so and I think I will second what Councilmember Revelle said about, I think we should stick with the bag side of things here. We're opening up another can of worms, I think, with the single-use, like straws and all that stuff. So if you can restate your amendment to the alternative version, then?
Yes. Well, if I can, Ms. Pratt.
That was actually my motion, I think, but
you didn't make.
Go ahead, Councilor. I did make a motion.
Ms. Pratt, if I can have you. To the point regarding single-use plastics, such as the clamshell, such as straws, and these other items, that is in our CARP plan, right? That by 2025 we would eliminate the use of those in our city?
That is correct.
And our CARP plan back in 2018 went through a very thorough, I don't think you're here at the point, but from, I think, all of our knowledge, went through a very thorough public process. Is that correct?
Yes, that's correct.
And there's feedback from the environment community, from all over Evanston on this CARP plan, and the council voted, I believe unanimously, to adopt it. So to say now, 2 years out from when our CARP plan that went through this very rigorous public process, to say now that, oh, we're not ready to look at single-use plastics, we got to go through another public process to make this we made the determination. And we said we need to get this done by 2025. And so I don't know where the confusion is. we had the discussion. We made the decision years ago. It's time for action. It's time for us to move. And if we can't even meet simple goals in our CARP, such as banning these single-use plastics, then I think it's disingenuous for us to, in a few weeks, to come back here and say that that our goal, that one of our top priorities for the next 2 years is CARP. Because we're not even meeting the simple goals that we've set in place for 2025. Let's get this done. We had the discussion. We know what we need to do. Let's stop pitter-pattering around what we know we have to do and do it. It was set in place years ago, and so I encourage us. I will make the motion to remove or to add back in the ban for all all retailers in alignment here with August 1st, 2023, and then I will separately make the motion. But I encourage us to follow the plan that we set in place and follow the guidance that many residents committed hours and hours and hours of their time and this council and staff to set these benchmarks for us, and let's actually meet them, and let's meet particularly this one a year ahead of time without having to go back through this process, this whole process again that we've went through on plastic bags, again with the single-use plastics, because we know what we need to do. So I move the first portion of that, which is adding back in the retail establishments under 10,000 square feet for the ban.
So, Chair, if I may, point of information from legal, my understanding of where we are right now is Councilmember Revelle made a motion, and after it was properly moved and seconded, I made an amendment, and I don't know where that went, but somehow it disappeared. So I don't know if legal can help us out, but unless I just completely spaced out, I made an amendment after Councilmember Revelle's motion was properly moved and seconded.
I'm happy to address that. As just what I clearly know is that you stated your intention to make a motion, but you never made the motion, nor was it ever seconded.
Well, I think what I said is I start off by saying I would like to make an amendment. I'm pretty sure that was my exact words. I don't know if
well, then it wasn't seconded then. If that's the case, it just didn't receive a second. And I didn't hear, and I would like to make...
Wasn't even given an opportunity. I think you just spoke immediately after that. But either way, it results in the same thing. I'm pretty sure I made an amendment, and I just want to make sure in the future those amendments are recognized properly. And I don't know if we, need to treat this like a football game, figure out how we can do quick playbacks to know what the order of things are. But I think it'll help just for future discussions and amendments, so we can kind of track along with what's going on. But that's all, Chair.
I apologize, just because it's the hybrid nature of this makes it just that level of difficulty extra. So can you? And I think I also kind of heard it as like you were stated your intent to make the amendment. Could you restate the amendment, please, Councilmember Burns?
If folks are having issues hearing me, and that was the issue, I will. Councilmember Reed, you can make the motion or the amendment. It all results in the same end. I just want to make sure in the future we're properly recording amendments and motions that are made.
Yes.
Well, I've made the motion. I'm waiting for a second. I would just say there's a difference between I would like to go to the beach and I am at the beach, or I'm going to the beach. I would like to versus I am.
Right. And I'm a grown adult. I understand the difference. And what I'm saying is that I said I would like to make it. I'm going to make an amendment. I said the amendment is, and then I went on. Okay. So in like to is saying I would like to, like I'm making the amendment. I would like to make an amendment on this. It's somewhat kind of colloquial, formal speech, but it's a norm. That's what you say when you're introducing something that you would like to do. Anyway, I will second Councilmember Reed's motion or amendment to the motion.
Okay. Just to clarify, this would take, and I'm looking here at the we're talking about the alternative version under where it says plastic bag ban, where it says alternative, right? This would say community-wide with no, so we just shift the other two columns where it says scope. We're moving scope from the original where it says community-wide and with no exemptions. We'd move that to the scope for the alternative. Yes. That's the only change, right?
That's the motion on the floor now.
So motion on the floor is that the alternative version of the plastic bag ban, that we're changing the scope to be community-wide with no exemptions. Okay.
Yes, and I seconded that, unless that was unclear.
Yep. Duly noted. Okay. Do we have any? We ready to vote? We can take. Oh, what do you have? Councilmember Harris.
I do remember the stores, like the bread store, talking about those plastic bags for the bread and the food. Does that fall into this as well?
No.
I just want clarity.
Those types of bags would still be exempted because they would be considered hygienic food bags. So there would be no tax on any type of bag like that. And in terms of the ban, it would be up to this board whether we would retain the language about banning pre-checkout plastic bags as well. I believe that's the intention.
Yes.
So in terms of grocery stores, the produce bags would no longer be able to be single-use plastic. They'd have to be paper or compostable bags.
Great. We're all clear then? All right. Oh, Councilmember Harris.
For the alternative, so we're voting on the alternative and changing community-wide, but I'm seeing 2023. I thought it was 2024.
Yes.
Okay.
We're keeping the same earlier start date from the alternative.
That's not what we agreed to when the businesses were here, but okay.
Okay. So we have a roll call vote on the amendment.
Councilmember Reed.
Aye.
Councilmember Harris.
No.
Councilmember Herrick Harris.
Aye.
Councilmember Burns.
Aye.
Councilmember Ravel.
Aye.
So we have the amendment passes, adding in the community-wide ban on the alternative bag tax, plastic bag ban tax. So now we will vote on the alternative version with said amendment.
I have my light on.
Oh, Councilmember Reed.
Yes, I would like to move that in alignment with our CARP goals that we include that we write into this a ban on all single-use plastics for April 1st, 2024 for all point-of-sale single-use plastics in line with our CARP goals.
Do we have a second?
Second.
Okay, we have a second. Any discussion on the point of sale? Councilmember Ravel.
Well, I guess I need a big definition of what would be included in that.
Thank you, Chair Gary Karas and members of the committee. I'm Brian Zimmerman, Solid Waste Coordinator under Public Works. Most likely the definition of single-use plastics would be anything that's a derivative of food serviceware that's coming out of a restaurant or deli or some kind of device that's only going to be primarily used once and then discarded. It'd probably be similar pitfalls to what we experienced the first time around with plastic bags, having different types of definitions and terms, so it would have to be crafted rather carefully. But if I were to take a general 35,000-foot definition, it would probably be things like utensils, straws, clamshells, other types of to-go containers that have that folding enclosure type definition. I don't imagine we would be looking at anything like pizza boxes or stuff like that, because those are primary devices that are used to transport those materials. That would be my first iteration of that type of definition.
And have we had any conversation with the restaurant community about this?
Not to this point, no.
Yeah. And just to Councilmember Reed's point about we adopted CARP and so we adopted everything in it, we did not, by any stretch of the imagination, agree to every last line in it without, we acknowledged that we would have to have a lot of further conversation about how to move forward with many of the details. I'm committed to our addressing single-use plastics in due time, but I guess I want to make sure we don't get ahead of ourselves.
Thank you. Councilmember Reed.
Thank you. Thank you for that definition. That is, also at the 3,500-foot mark definition that I am seeking. I trust our climate team and our law department to craft that definition in a thoughtful manner that achieves the goals that we seek to achieve. But again, to the point about, we had a community-wide discussion about these things, and yes, obviously the adoption of CARP was not the adoption of all of those items, but why would we set them as goals if we weren't prepared to actually meet and achieve those goals? Otherwise, that just makes CARP a fancy document that we pat ourselves on the back about and set on a shelf and feel good about saying that we're going to take action without actually taking action. And again, it's clear the harm that these products have in our community. Our businesses are members of the community. And really, particularly in Evanston, active members of the community. There are likely a lot of businesses involved in the crafting of our CARP plan. When it comes to what should be as clear as this goal, particularly this goal in our CARP plan, I don't think there's a lot of discussion to be had. We either are saying that our climate is a crisis, that our inaction, particularly in addressing human activity and the human cause of climate change, we either are saying that is a crisis or it's not. And if it is a crisis, getting rid of these single-use plastics is the first small step that we can take to actually make a difference in that realm. And so, we'll have. Again, this is another one where it's going to take over a month to get 2 readings of this. We can certainly have conversations, but I will note, similar to the other item, our businesses were saying, hey, ban styrofoam, ban these other things. They thought that would be more impactful. We're not saying tax those items or anything of that sort. We're saying, hey, in 2024, less than a year before we anticipated these to be banned, according to CARP, let's ban them now, and let's not waste more time having a discussion about something that we know what the outcome should be. They shouldn't be here. And we need to switch and find alternatives and make sure that Evanston is on the forefront of this so our businesses are well adapted to it as more changes come. Thank you.
I'd just like to add, I think we all agree with those sentiments. I think there's some generally real challenging questions that need to be answered before being able to fully understand the breadth of that move to that kind of direction. There's challenges with different alternatives where it's been more defined and well played out with bags. There's far less concrete direction as the best alternative in those spaces. Even places that have been far more progressive and ahead of us in these different types of actions are still finding their way when it comes to single-use utensils and items. There is also infrastructure questions when it comes to things that are compostable. This area and region is far behind places like California or Washington in terms of its compostable facilities, and those are things that we don't directly have control over, and it would do us potentially more harm than good if we end up creating more compostable items that ultimately just have to go to the landfill anyway. So I would urge just some general caution on being a little too
I withdraw the motion.
Okay.
Councilmember Burns.
I withdraw my questions then.
Okay. So
I hope to see us take action on this before 2025, and I hope that this council does not vote to make CARP one of our priorities when it comes time to set our priorities. We should drop that as a priority and really focus on the next 2 years on things that we can actually make a difference for. So.
And Chair, if I may recognize, I will. This is actually what I was going to say. I actually think I would like to do something similar to what we did with the Fair Work Week. I want to make sure this does come back. I think it's something that we should ban. I'm not sure the business community was pulled into the CARP planning process as much as they have been through the Fair Work Week and now the plastic bag ban discussions. And so I would like to make a motion. I am making a motion right now. I'm making a motion to make sure we bring this back. The issue of what are the containers called again? I'm sorry. The
clamshell and the single-use plastics.
Single-use point-of-sale plastics.
Yes, if we bring that back, how long do we think we need, Brian, to look into this?
I think we can start having these conversations with restaurants in that community specifically almost immediately. As most of you are aware, we're trying to build a circularity roadmap with our community because one of the areas of our CARP plan that wasn't necessarily fleshed out was the waste one, and we're trying to develop more strategies and ideas on how we best tackle that, not just from an emission standpoint, but just our general footprint of how much we consume. So a lot of that interaction will be tailored towards businesses over the coming months. So I don't see why we can't bring it up in a general time frame.
So I will offer this up. I kind of feel these two things are sort of separate, bag and the single-use plastic. I'm willing to be a co-referrer to a referral to look into the single-use plastic ban. And that way I think there'd be a little bit more in-depth discussion about, preparing that. I don't know if that changes your motion.
I'll list you tonight as a co-referrer.
Sure. Sounds good. And so that, Councilmember Burns, is that satisfactory?
I think if we think it needs to go through the referrals process.
Well, if we're treating it separately, it would need to. Sorry, point of information.
Go ahead.
Point of information, if we're treating it separately as we are separating it here, it would be a completely new ordinance, which would...
Okay, then I'll withdraw the motion, and if it needs a referral, then I will co-refer that as well.
Yeah, sure. Definitely put me on that. So, so that now we are at the alternative version with the amendment for the community-wide plastic bag ban with no exemptions. So we will take a roll call vote.
I'm sorry, I have one more amendment here, which is, again, I think it is critical that we have the funding for the education and to provide resources to the communities that will have a tougher time adapting to this. And without the education component, we're just throwing people out there and we're saying, hey, take this big, essentially, it's a behavioral change. And for some people, it may be a big shift in behavior changes. And we're saying do that with zero education, zero resources, just figure it out. And keeping this at 15 cents will allow us to have the revenue that I believe the health department or Kara's department, whoever needs it, will need to make sure that they're educating people. I think it should be a combination of both, because we want to make sure from a health perspective that folks understand that they need to wash these bags. There's so many people that do not understand that they need to wash their cotton in reusable bags, and they're just reusing it over and over and over and over again, and they're getting themselves sick. And so we need to educate people on that. We need to make sure that people know that this ordinance is going to be taking effect, especially taking effect as soon as it is. We need to have an education campaign, and it would be, I think, similar to what was said earlier. We might be doing more harm than good if we aren't having that education component, and the funding for that needs to come from somewhere. So I will ask Director Ogbo, from a health standpoint, do you think making sure that we have revenue, wherever it comes from, to ensure that we're doing education, ensuring that we're educating residents about this, do you think that makes sense?
Yeah, I think an initiative as what we've been deliberating and having conversations about, there has to be an educational component on it, especially in those neighborhoods or areas where they might not have the access to educational tools, to go into those areas and figure out ways, methodologies to educate individuals about the ban, about, as you mentioned, washing the bags and the health component that is involved with such. So an initiative of this magnitude definitely needs an educational component, and if it's the will of the City Council, it will be an element that we'll embark on with our climate team to figure out ways in which education can be disseminated to especially those individuals who might not have as much access as others regarding these items.
Thank you. And last question, Kara or Director Ogbo, do you all have the resources currently to make sure that particularly low-income folks have access to these reusable bags?
We don't currently have financial resources to provide that type of access, but we do have a robust volunteer community and new staff in my division that could communicate with those populations, but not anything physically in terms of reusable bags.
Yeah, and so I appreciate that, and I think we do have a robust community here who are willing. We have tons of people. I'm sure many of us up here have maybe far too many of these reusable bags, and we could stand to donate some of those to a community effort. But we also just need the resources to make sure that those community efforts exist, that it's getting those resources are being saturated in the community, and unless we're saying that the city is just flush with resources to do this, which I don't think we are, we have limited funds, this will be the source of revenue to make sure that we have what we need to fully implement this in a thoughtful and smart way. And so I move that we, in line with the original version that the tax be 15 cents and with the additional revenue going split between the climate action team and the health department to provide the resources that we need to make sure that the education component and resources are available.
Okay. Motion on the floor. Is there a second?
Chair can second too. Make sure that we, all right.
All right, so without a second, we are back at the...
If I can take the floor for 30 more seconds, all right.
Okay.
So we just heard from our public health professional, we just heard from our climate team that folks need to be educated on this. And this council, I don't know where the money is going to come from to do that, but what we're saying is we don't care about proper implementation. To me, this, without proper implementation, this is just another, feel-good moment where we get to pat ourselves on the back, and yes, we made some progress, but again, we are going to leave out our residents who are least proximate to power, who are low income, and we're not going to provide them with the resources they need to make this adjustment. It's disappointing. Thank you.
Okay. The vote on the floor is for the alternative version with the amendment for the community-wide ban.
Councilmember Ravel?
Aye.
Councilmember Reed?
Aye.
Councilmember Harris?
Aye.
Councilmember Harris?
Aye.
Councilmember Burns?
Aye.
The ayes have it. We will see the plastic bag tax at City Council. Moving along, we are not, if someone could please make a motion for HS3.
I move item HS3 decriminalizing certain controlled substances.
All right, is there?
I want to be clear. I move item HS3 decriminalizing certain controlled substances. We have someone from the ACLU who sat on the line for hours. Jesus Christ.
All right, discussion on the floor. Actually, I have a question for Commander Glue. I'm just curious how many psilocybin mushroom arrests we've made.
Okay, for the sake of this conversation, I'm going to refer to everything as mushrooms or psilocybin. But in the last 10 years, none. And I will speak a little bit more on that. I think in my entire career here, I've come across mushrooms one time, and that was probably at least 15 years ago. So.
Okay, thank you. Councilmember Reed.
Thank you. Again, good news that we're not arresting a lot of folks out there with this. But we know that folks are using psilocybin within our community. It is currently, a felony under state law. To me, this is doing two things. Similar to actions that we've taken in the past, it is creating an alternative, right? Any amount, and Commander Glue, if you can always feel free to correct me if I'm saying anything wrong. It's the same thing with our attorney. Any amount of psilocybin that you possess is a felony, correct? Whether it's a gram, whether it's 15 grams.
Yeah, it would be my understanding that any possession of that under state law, as it is now, is a felony. That's without refreshing, but that does not sound off base.
And actually, I'm sorry, we have Ben on the phone. Ben, do you want to answer that, if you have?
What you said is correct, Councilmember Reed. Psilocybin, like all other scheduled controlled substances, Schedule I controlled substances under Illinois state law, and simple possession of any quantity whatsoever is classified as a felony.
Thank you. And so with that in mind, we have created alternatives to felony possession of items before, right? Because we don't want people in our community being arrested for silly things and potentially facing a felony. It's wonderful that this has not happened yet, or at least it has not happened in the last 10 years, as far as the records indicate. I actually recall, very distinctly recall, as city clerk sitting here during a presentation and seeing that there was at least one or two arrests. Maybe we're just outside of that 10-year mark, but I remember in around 2017 getting a presentation from the then police chief about different drug arrests and seeing at least a couple under this category. So this is in line with what comparable communities have done. In fact, the language that I put into the referral was mirrored exactly from Ann Arbor, Michigan, which again, we cannot create an alternative to, we cannot decriminalize an action that at the state level is seen as a felony. We cannot Home Rule Authority does not allow us to overrule state law in that regard, particularly relating to felonies. But we can create a local alternative, and we can direct our police department to do essentially what they've been doing to make sure that it's, codified, that we make this our lowest priority for enforcement and for prosecution. And we don't waste any city resources enforcing potentially this law, and we don't put ourselves in a situation where we are ruining, right? If this slips up even once, we ruin someone's life for possessing a plant that, for those of us who are religious, or if you're not, that, someone, that God, that the Creator, whatever, that naturally grows here on earth, we would ruin someone's life with a felony because they possess psilocybin, which was accurately described in public comment. When you look at the list of illegal or controlled substances, psilocybin is at the bottom of the list as far as, the harm that it causes to the individual, the harm that it causes to society. Psilocybin is not addictive. And Ben, I know you're with the ACLU. I don't know if there's, anything that you'd like to add about psilocybin from either the legal perspective or the research that has been done to support the ACLU coming to its determination on this.
I'm not really, I don't have special expertise in psilocybin. I think I would be, my organization would have the same position no matter what substance this council was seeking to move away from criminalizing people, because the truth is we've been trying that approach for 50 years and it hasn't worked. It's only done more harm in our communities. But I think what you said is true, and there is research to back up that this particular set of substances, that there is some research that actually shows a benefit, a therapeutic value to the use of this substance, in addition to not being associated with harms like addiction or overdose. Those aren't things that are associated with the use of psilocybin like they are with some other controlled substances. So in terms of a starting point to dismantle this edifice of harmful drug war era laws that have done nothing but do harm to our communities, this is a great starting point. And that's what I have to say about that.
Thank you. I will. I'd love also to see we had the Clean Air Act folks come out with cannabis consumption lounges. There's also plenty of research about, and it was mentioned during public comment, about as far as the therapeutic use, that psilocybin can help with folks curtailing addiction to other substances such as tobacco, such as alcohol, which are far more at the top of the list, particularly alcohol, at the top of the list for controlled substances that cause harm both for the individual and for society. And so I think what we're looking for here, this is not it's for action, but it's for action to direct staff to come back with more research on this. I think the research is clear. and not I think, I am sure that the research is clear on this, that this should not be a substance that the city of Evanston uses any time to, in any of our limited police hours, to try to enforce. We should make this our lowest enforcement priority. We should create an alternative so folks do not have the threat of a felony hanging over them if they are in possession of psilocybin. And, we should make sure that folks have, non-criminal access to this if they, see fit for the therapeutic use. Again, as noted, in no way will this legalize the retail of psilocybin or any other entheogenic plant. It will simply create an alternative for the felony and direct our police department to make this their lowest priority. And so I would hope that we can move forward with having staff do more research into this matter.
Thank you. Councilmember Ravel.
So I think in our memo, our legal department said roughly that municipalities may not reclassify an act determined by state law to be a misdemeanor and make it a felony, and vice versa. So I guess my first question is what actually are we trying to do?
If I can respond to that. That was an argument that I had previously when it came to the burglar's tools ordinance. I was seeking to eliminate the burglar's tools ordinance because it already is a felony charge, and I made that exact argument because at the time that was my belief. The law department very clearly said, in support of Council Member Chair Hedikadis' amendment to the burglar's tools ordinance, that yes, in fact, we do have the ability to create an alternative to an alternative charge that is a misdemeanor. And so if there is now a reversal on that position, that affirms what my initial suspicion was around burglar's tools, but I'm happy to hear further.
It's just, that's what I recall seeing in the memo. Let me just find it. Okay.
The legal department has never said that we can make a felony a misdemeanor or a misdemeanor a felony. That is a longstanding impossibility. However, we can make alternate suggestions for enforcement. So the possession of mushrooms will still be a felony,
sure,
but the way that we choose to penalize or not penalize it as a home rule municipality is what is within our jurisdiction.
So, and that is in alignment with what came out of the burglar's tools discussion, that we can create a misdemeanor charge for this that would allow our officers, if they saw fit to charge someone with something, for whatever reason, they would have this alternative option, which, again, I would hope is not used, because the other part of this is to make sure that we're not charging people with any criminal charge just for merely possessing this item. But it would take this would take away the threat or greatly reduce the threat of a potential felony charge as the state wrangles with decriminalization of this substance as well.
Councilmember Burns.
Yeah, certainly.
You're breaking up.
Just wanted to say I support this at least moving forward. I want to see how the discussion develops and what questions people have. But we all know when these type of prohibitions are enforced, that they typically impact POC communities the most. And as we heard from the member of the ACLU, that no matter what your bias, whatever direction your bias points you to, if it points you in the direction of more enforcement around these substances, I think you can't point to any research that shows it's effective, other than incarcerating, leading to incarceration and disrupting people's lives and potentially whole families. And so I'm looking for some alternative approaches, if not to decriminalize this. I'm looking to hear some different approaches from our colleagues who may disagree with this direction on how we can make sure that in a future city, it may be different officers when this is enforced, that it doesn't impact people of color, anyone who chooses to use this substance. And so I certainly support moving this forward. Again, I don't think it is appropriate for us, and this is just me speaking, not saying anybody's doing this, but to use kind of long-standing but debunked stereotypes around different substances or different issues in general to make decisions. I think we're here to lead and to follow the research and to sort through what we hear from our community, concerns from our community, but also to weigh that against the research and what we know today about, within this context, these substances, their harm or their benefit, and who they impact when the criminalization of them are impacted. So I certainly support moving this forward for more discussion. Thank you, Chair.
Thank you. Councilmember Harris.
Thank you for the recognition. So I think I'm a little confused, and maybe because it's so late and we still have people who've been waiting here for hours to name a street, and I'd like to get us moved on, but I think I heard legal say that it is still a felony. Is that correct? Not that it would be a misdemeanor. How we deal with that felony is up to our discretion, and maybe I'm wrong with that. Can you please clarify for me?
That is correct. We cannot change what the state has deemed a felony. We can choose to enforce it differently, meaning we could choose to make it a low-level priority for our police department, but we cannot change the fact that it is a felony.
And I would tend to believe if we haven't arrested somebody in 10 years, it is a low-level priority. Am I correct?
Yeah, I just don't think it's something that we come in contact with or recover very much. It's very, very infrequent. So, and if I could speak a little bit about what Councilwoman Reed said and legal counsel, basically for us in the past when there has been I would say like a decriminalization effort or a concurrent city ordinances, we opt not to charge somebody with a felony and we make the discretion to charge them with a misdemeanor. So the felony is not in play at all. It's just the city ordinance that they're charged with.
Okay, thank you. Councilmember Revelle.
With Councilmember Harris, that it sounds like it's a very low priority currently, and that's a good thing. I guess I just want to add that I did do some online research about this, which I really hadn't had a chance to do before. So it's interesting. There is quite a bit of research underway studying the potential health benefits of these substances. But what I found particularly interesting is, and this is from, where is this from? Johns Hopkins. So they say that if these substances are found to be safe and effective, then the next step would be to petition the FDA to reclassify the drug as no longer Schedule 1, but make it a Schedule 4 drug. But even as, this is the part I'm wanting to mention, even assuming if the FDA agrees to reclassify it, the researchers don't recommend releasing psilocybin into patients' hands, even with a prescription. We believe that the conditions should be tightly controlled, and that when taken for a clinical reason, it should be administered in a healthcare setting. So I guess I want to just caution us to think that even going forward, if these substances get reclassified, we still want to think about how we wanted residents to use them.
Councilmember Reed.
Thank you. And I'm really happy to hear the questions that Councilmember Harris had and what you just shared there. In no way is that would this effort say, hey, we want you to use psilocybin. We're not promoting the use. We're simply saying, as you just noted, Councilmember Revelle, it is a good thing that our police department is making this a low priority, or that we're not seeing this very much. So let's just put that in writing so our residents understand that they, that here in Evanston, you will not be arrested and criminalized and add harm on to, add additional harm to one's life with the threat of potentially being arrested for this. And if for some reason our department absolutely has to use its discretion, right, because as it was noted, we cannot eliminate a felony from state law. We didn't eliminate a felony from state law when we made the change to the burglar's tools ordinance. We didn't eliminate, a felony from state law when we've made, when we were early on, I believe we were certainly before the state in decriminalizing low levels of cannabis. And so we did not eliminate that from being a felony at the state level. We simply provided an alternative to arrest, an alternative that aligned more with the research, more with the data, and we made it official by putting it in writing on the law books, so residents understood very clearly what they could and could not do. And what this motion is to instruct staff to do their due diligence, come back with more of the data to support or to not support it, to paint a clear picture of what action we're taking here. And I would encourage us to seek that information, which is perfect, should perfectly be in alignment with our goals. Thank you.
Councilmember Burns, I saw your hand up. Is it down again? Okay. All right. It looks like we are ready to take a vote.
Councilmember Reed.
Aye.
Councilmember Harris.
No.
Councilmember Harris.
No.
Councilmember Burns.
Aye.
Councilmember Revelle.
No.
The ordinance does not pass. We will move along to our next HS4.
Again, point of personal privilege while the chair speaks. This cannot be a body that in the future says that they follow the data, follow the science. Because too many times, repeatedly, we're not listening to our public health professionals. We are not following the data. We're not following the science. We are not understanding the clear harm that the war on drugs has played on our community, and we are jeopardizing the lives of more and more of our residents with this. And honestly, this is a council that is disappointing to me.
Okay, can I have a motion for HS4?
So moved.
Okay. I think this is very unanimous up here. So we can have a vote.
Well, I wanted to,
Do you want to say?
if you wanted to say anything, if
Yes.
not, we've had you on.
Yeah.
Okay, I
Okay.
just didn't want to not give you that opportunity. Yeah, so this is in my ward, and I would like to move forward with this and make this a reality. We're excited about this. So I call for the vote.
Excellent. You have a roll call?
Councilmember Burns.
Aye.
Councilmember Revelle.
Aye.
Councilmember Reed.
Aye.
Councilmember Harris.
Aye.
Councilmember Harris.
Aye. And with all in favor, HS4 passes.
And we'll work on a date when that happens, the unveiling and all of that. Thank you for your patience.
We are now.
And Chair, if I may, I just wanted to say in the future, I'm totally fine. I guess this goes for all of us, moving items like that up if we have people in person. I don't know if that's the case, but just want to register my support for that.
Sure. We had lots of items that people wanted moved up, but it's a long meeting. So we will move to, if someone can move HS6.
So moved.
Any discussion on HS6? So, Councilmember Reed?
Yes. Generally, I support this. I'm excusing myself from this meeting. I am sure that this has every chance of passing because wealthy, mostly white folks who live on the north side of our town support this, and this is a status quo council that can only take up issues that impact our wealthy northern residents. When it comes to other groups of folks, we have deaf ears, we stand with the status quo, and we cannot take action, and it is disappointing and disheartening that this is not a council that follows the science unless it impacts the noise levels of wealthy folks on the north side of town. Disappointing.
Councilmember Harris.
So I did have an issue with this. I wanted to look at the time, and I did talk to Councilmember Ravel. So when you're looking at someone who works third shift, they're coming home at 7 in the morning, and they've got leaf blowers happening. So we did talk a little, and I'll let her speak to any changes if she was willing to make, and maybe not.
Councilmember Ravel.
Well, just for a little history, before we amended the leaf blower ordinance to set a deadline for a ban on gas-powered leaf blowers, the hours for permitted use for leaf blowers were Monday to Friday, 7 a.m. to 9 p.m., and Saturday, Sunday, and holidays, 9 a.m. to 5 p.m. So then basically during the council discussion with kind of no preparation, the amendment was made to make it Monday to Friday starting at 9 a.m. to whatever it is, 4 or 5 p.m. And in retrospect, given that we were now going to have quiet leaf blowers, and given it seems unrealistic for our landscaping companies to not be able to start work until 9 a.m. So my suggestion is that we go back to the hours that we used to follow when we used to have noisy leaf blowers, and instead now we would, it's quite amazing. You walk down the street and you see a guy raking leaves and you maybe hear a little whisper noise of a quiet leaf blower. I think it's really not, it's not the disruptive issue that it was not so long ago. So that's why I've recommended the basically reverting back to the hours we used prior to amending the leaf blower ordinance.
7. It was 7 before. Yeah. Okay. Any more discussion? Seeing we have none, can we please take the roll?
Councilmember Ravel.
Aye.
Councilmember Reed. Councilmember Harris.
No.
Councilmember Heracars.
Aye.
Councilmember Burns.
Aye.
The ayes have it. We will move on. If I can have someone move HS8.
So moved.
Do we have any discussion? Seeing none, can we please take the roll?
Councilmember Burns. Councilmember Burns.
Aye.
Councilmember Ravel.
Aye.
Councilmember Harris.
Aye.
Councilmember Harris.
Aye. The ayes have it, and that brings us to the end of our meeting. Thank you all for your patience.